Well, good morning. I don't know if you want to start, but just to let you know, in addition to myself, I'm the Director of Development and Communications for CPWD. So I wrote the grant. We also have Maria Stepanyan, who's our Executive Director here on the call. And we also have Heather Camper, who's our Director of Core Services. So she oversees all the independent living services, which were what we highlighted in our proposal that we want to use the funds for to support people, consumers with disabilities in Longmont.
Thanks, Jude. So what we're gonna do is we have about 15 minutes. Karen Roney will time us, and we're pretty good about staying to 15 minutes. Primarily, it'll be question and answer. Caitlin Abbott is our chair, and she will lead the conversation. She will facilitate the question and answer time. And then at the end, if there is time, then we will allow you to share something else you would like to share. So I'm gonna turn it over to Caitlin.
Hi, good morning, everyone. Thanks so much for being here, and thanks for the quick introduction so we know who everyone is. Is there anyone on the board or staff who has a question that would like to kick us off? Graham.
Thanks, Caitlin. Good morning. My question has to do with the logic model. I see that the goal is to increase independence, and then you're measuring it looks like participation in various activities. I'm wondering if there's any way that you can actually measure independence rather than measuring, just sort of perpetual use of your services.
That's a great question. Unfortunately, to do something like that, it would mean we'd have to compartmentalize everybody into the exact same sort of capacity and needs. So all people with disabilities in our community have varying capacities and varying needs for independent living. So for example, somebody with a longer term disability might need, as you said, perpetual services in order to maintain. Somebody else who has a head injury or is transitioning out of a nursing home might need shorter term services in order to maintain independence. So because we're a center for independent living, we basically, our whole goal is to assist people to achieve independence based on their own assessment of what their goals and needs are. Our independent living advisors spend a lot of time to engage them in that. And we really encourage self-advocacy rather than sort of a case management model where we say, okay, we know what you need, and then we're going to give you this. And when you cross this goal, you've got it. It's a lot like raising kids. If you have, a third grade class, all the kids will go through that grade, but how many of them got, an A in reading, and how many of them excelled in gym? It's just that everybody has a different need. And so we try really not to force people into a box that way. Over the years, we've done other things, Graham, where we've laid out okay, we're going to deliver X number of transitions, or we're going to do X number of information referrals as ways to do that. That also forces us to project what the community is going to need. And since we've been around for 44 years, we're really expert at receiving the needs from the community and adapting to that. And so this year we may focus more strongly in youth transitions for kids with disabilities who are getting out of high school. And another time, or we might focus more in helping people with housing if the moratorium goes away. But in another time, we might focus more on another area, like people with visual impairment. So we try not to box ourselves in. I don't know if that helps answering your question, but
yeah. It does. Thank you very much.
Yeah.
Brian.
Thank you, Caitlin. Good morning.
Good morning.
I think I have a couple questions, but I'll actually tag on to the one that Graham asked, because you mentioned in your application the CILS first database that you use, the customer database. And I wanted to just understand a little bit better how that works. And I think when you talk about your independent, the goals that individuals set, it sounds like those go in there and you are able to report against those. Is that correct?
Yeah, correct. I'd like to answer this question in two parts, just to say a couple words and then turn it over to Heather, our Director of Core Services, who manages the database. But just as a languaging thing, it's a consumer database, and we use the word consumer instead of client because of our independent living philosophy, that they're choosing to consume, it's not even the best word, but they're choosing to engage in these services towards independence. An independent living advisor then would identify the goals. Let's say it's like, I want to get accessible and affordable housing, and I want to apply for successfully and get my Social Security disability income benefits. And then next year I want to start looking for a job. Those goals would be, it's a regular tracking database. So we'd have the person as an intake consumer, their goals, all the activities that and their accomplishment towards that goals. And we can pull reports on that and say, we've had X number of people have done this, X number of people have achieved their goals, X number of people have done these types of activities. So we can report on that. But Heather, what else would you like to add to that?
Yeah, that was great. I would say that, every consumer we work with does have an active goal, and many have multiple. And so that can be kind of a short-term, easier goal, and some are very longer, like, maintaining that housing or applying for SSDI benefits. That can take quite some time. So staff are trained to and have those really solid goals discussions, and make it, it's driven by the consumer, what they want to achieve, not by our staff. So we do kind of associate all of our services when we do our notes to that goal. So what did we work on for this hour that you were in the office, and how does that relate back to your goal? And like Jude said, exactly right, we can run reports on whether they were accomplished, or with the consumer decided to cancel that goal for whatever reason. And then the other thing on goals, just want to mention, is that staff are trained to make them really in a SMART goal format. So specific, measurable, actionable, timely, and realistic. I got those letters mixed up, but so it's not just like kind of throwing out some idea. Like, we're really keen in on how you want to accomplish that, and what's our role in that, what's your role, so that we're never taking away that control from them and their part in achieving those goals.
Thank you, Heather. So just real quick, so do you run those reports and use them to make management decisions in the organization?
Definitely. That's something that's on my plate to run pretty frequently, and to see the progress being made.
Brian, can I add very quickly also that we do annual consumer satisfaction surveys to find out how we're doing overall, if people are gaining independence. We use that information to inform our programs also too, if we need to make adjustments. Yeah.
Great. Thank you, Jude.
Mm-hmm.
I have a quick follow up, and then Eliberto, we'll go to you. With those, could you share an example of something that may have come from a recent, like, running those reports, and a change that you have made to the organization based on the data that you've gotten out of those reports?
Sure. Let me think of an example. I think one thing we are seeing is, all consumers have to have at least one goal active, but I have been seeing some consumers, like, in their notes, they're working on lots of other things. So just training staff to kind of make sure they have that goal listed out, because they truly might be working on 5 different goals, and just training staff a bit more to get more specific on what they're working on. So, maintain my independence. That's what we do for sure, but what specifically, what are the steps, what is that going to take? So kind of keeping an eye on that quality piece, I think, is what I've been seeing, and giving that training and coaching to staff. And I do host every other week. So every 2 weeks, we have database training, and we have these awesome discussions on goals and that quality piece too, not just did you enter in this field in the database, but how to, like, really engage with someone to help them be successful.
Great, thanks. Eliberto.
So this is more of an agency level question, and fun. So you put in your proposal that you're expecting 25,000 in let me look at it again, sorry. Make sure I get this right. In your budget, your proposed budget, agency budget, I think you mentioned 25,000 in fundraising. And so, I can tell that the majority of your funding comes from program fees and some government contracts. And yet in your, I guess what I'm trying to connect is one of your strategic goals, I think is a good strategic goal, is more outreach and visibility. And I think that would also lead to fundraising. And just wondering what are some of the thoughts you have on achieving that strategic goal and increasing, that third leg of the stool when it comes to development, right? So that's my question.
Thank you, Alberto. Yeah, that's a good question. We do have a fairly diverse funding stream. Well, first of all, we get this statewide independent living money from the state of Colorado, because we are a center for independent living. So it's a specific mandate that connects us to that source of funding. And there's, I believe, 9 centers in the state of Colorado right now that are getting that funding. So that's a pretty secure source of funding. And on top of that, we do have other government grants and contracts. And then we move down into our municipal and statewide contracts, and then other private grant funding, which is great. And then our fee for service programs, just to be 100% clear, everybody, all of our services are offered at no cost to consumer. When we say fee for service, it means that we are providing services and billing Medicaid for reimbursement. So nobody ever has to pay a dime to come and get services. And those programs have shifted. And over the past couple of years, we've shifted our focus on which programs. We have a program such as our employment program, or our Veterans Independence Program, which is a program that supports veterans with disabilities who want to live independently. Those are growing very well. So we have a lot of security in our funding. In terms of individual donations, or donations on the third leg of the stool, as you like to put it, in a model environment that makes sense to have that diversification. In our practical application of it, we're focusing our attention not on having equal amount of funding in terms of donations, but on growing that little by little every year. And we have been focusing on our outreach more as a sense of awareness. What we're finding is a lot of people in our demographic aren't necessarily connected to money that they want to part with to support our organization in the same way that maybe the Humane Society or the Safe Shelter might be. But what they really want to connect us, we're connected into resources. So we're focusing on our awareness in order to increase visibility. We want that. So like in 2 years from now, we don't want any of you guys to not know what CPWD is and have to go to our website to look it up. We want you to know, oh yeah, they provide independent living services. So we are growing that little by little. And I know it's not a lot compared to some other organizations, but that's the way we've outlined our strategy. And we've been really successful and solvent and growing for years now. So I don't think there's any threat of insolvency or funding or financial weakness as a result of that. I don't know if that helps answer your question.
Yeah, thank you.
Okay.
Karen Roney.
Good morning. So in looking at your org chart, and maybe I just missed it last year, have you changed up, Maria, how you have organized the agency? It just seems like it looked a little different from what I recall from past years. So just wonder if you can comment on that.
Sure. Good morning. I don't remember recently making significant organizational org chart changes. One thing that happened last year, or is currently in the process, is that we closed our home health program, but that really hasn't reflected in organizational chart. As far as structure goes, has remained the same.
So I guess maybe probably the staff member that we work most closely with in Longmont is Diane Groff, and I just noticed that her title, or what she does, is different. She used to be linked to the Longmont office, so that was really my trigger for the question. Was because our relationship with our knowledge of Diane, and so that was the catalyst for the question.
That helps, Karen. Thank you. Yes, that piece did change. I forgot about that piece. Yes, Diane is still there in her same role in relationship to the Longmont office. One piece that has changed is that she has taken also role of a mentorship for our staff, and training pieces for staff and community partners to really enhance the integrity of independent living. So she has taken on that role in addition with the management of the Longmont office. So her role with the Longmont office has not changed, but she no longer directly supervises any staff. In that, in place of that, she provides training and mentorship to all staff.
Okay, thank you.
Yes.
I should have asked that differently or more
Yeah,
clearly.
I'm sorry.
No,
Her
no, no.
title has changed, but not the org chart. Yes.
Got it, got it. And then the last question I had was really around I believe you called the IDEA committee. So what you're doing in terms of equity, diversity, and inclusion. So can you talk about a particular recommendation that came from that committee that the agency has implemented?
Yeah,
If there has been one.
Sure. One thing that has come out have been a lot of trainings that we have brought to all staff and consumers, conversations with consumers. And another thing has been language in our anti-discrimination policy that the board uses that got modified because of the IDEA committee and the language we had used in IDEA committee. And the statement that the board adapted that was produced by the IDEA committee, that statement now is used in our anti-discrimination policy and in many of our postings. They have made some edits also to how we are recruiting. We have been a lot more aware of any positions that we are posting where we are asking for bilingual staff. The job description in its entirety is translated in Spanish and the posting is published in Spanish.
Okay, great. And our 15 minutes has passed us by.
Thank you for having us. Good to
Thank
see
you all for
Thank you.
Thank you all for being here.
Thank
this
you for
morning.
spending your morning with us.
Okay.
Bye.
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 It's really hard to avoid the urge to hang up when we say goodbye. It's such an automatic thing. It's like, oh, we're done with the call. See you. Bye.
Bye. Well, you can always hop back on.
Yeah, true. If Eliberto will let me back in.
That's the key.
Good morning, Rosemary.
Good morning.
Thank you for joining us. So this is our funding hearings for the Human Services Agency funding. You've done this before. We have 15 minutes. Karen will be our timer. It is primarily question and answer from the board. And if there is time at the end of those 15 minutes, then we will allow you to share something you want to share. Caitlin Abbott is our chair and she will be guiding the facilitation. So I'm gonna turn it over to her.
Okay, thank you.
Gina's here as well.
Yes.
I'll let Gina finish connecting. Good morning. Thank you both for being here today. As we get started, I want to open it up and see if anyone from the board or staff has a question to get us started. Deanna.
Morning. Thank you for being here. As Caitlin said, I just had a question about the budget shortfall. So I note that obviously there's a pretty significant budget shortfall on your application associated, it looks like, with spending down or expending funds from a large gift that you received. I guess I was just curious what the plans are for this obviously significant amount of money.
Yeah, hi, Rosemary. And I'm sorry, my camera's not on. Hi, everyone. My name is Gina Nacera. I'm the Vice President of Community Impact at Mile High United Way. I work closely with 3 programs that are in our Community Impact Division, and PI is one of those programs. So I work really closely with Rosemary. I'm assuming that you are talking about the Mackenzie Scott gift. Is that correct?
So the application didn't specifically reference something. It just said that the Mile High United Way received a large gift last fiscal year, and we will fund a specific large project unrelated to the request.
Yes,
So I was
yes.
just
So
curious
that's it.
what that.
So
Yeah.
thank you, Deanna. Yes. So Mackenzie Scott, who is many of you all know, is Jeff Bezos's ex-wife and received so many billions of dollars and is very much a philanthropist and has supported many nonprofits around the country in the last 2 years. And Mile High United Way was fortunate enough to receive a $20 million gift from Mackenzie Scott. Unbeknownst to us, the way that they do it is somewhat secretive, her and her team. And we actually got a call towards the tail end of last calendar year, informing our CEO and president that we were one of the United Ways chosen in the country to receive a gift. What we've currently done with it, Deanna, is we have put approximately $4 million additional dollars in our strategic investment grant program, which funds nonprofits, a lot of family resource centers, a lot of basic needs, emergency needs in our 7-county footprint. Obviously, Boulder and Broomfield is included in that. So many of the family resource centers received funding from us. So our strategic investment grants increased by $4 million this past year, thanks to the $20 million gift from Mackenzie Scott. I believe we put approximately $5 to $6 million in our reserves to just sort of build up that investment so that we could invest more as time goes on into our programming, but we want to build it up. And then we have committed to using 10 million of it towards a transformational gift. And we have a board of directors committee, our executive team, and a consultant working with us on what that transformational gift will be. We're really looking at a focus on wraparound services within one or more of our communities that really include a lot of our own programming, like early childcare, like potentially economic mobility opportunities and other educational programs that we also have within our community impact division. I think there will be somewhat of an announcement sort of outlining what that will look like, most likely by the end of this calendar year. It could go into the first quarter of next year. But we've been working on that now for at least 6 months, still sort of in the development stages, but I think they're making some progress. I hope that's helpful.
Yeah, very much. Thank you. And that's exciting.
It is. Whenever anyone would give you $20 million, it's pretty exciting.
Brian, I see your hand raised.
Yeah, thank you, Caitlin. Good morning. I have a question I could only kind of discern it from the agency demographics, but I'm looking at the populations of the areas you serve that you spoke of in the application, and Longmont or Boulder County in general makes up 10% of that population, and about 1.2% of the people served by your agency. And by contrast, Metro Denver makes up 88% of the population, but 99% of the people served. So I'm wondering, are there plans to expand your service in Boulder County? And do you have any thoughts on why that might not be more proportionate?
That's a great question, Brian. I mean, just, looking at it from a historical context, Boulder and Broomfield counties came into the Mile High United Way support network on July 1st, 2019, when Foothills merged with Mile High United Way. And so they're fairly new counties to Mile High United Way in the last couple of years. What we've done, we're really proud of, is we have committed to not only being a grant maker in the county, providing hundreds of thousands of dollars to family resource centers, early childcare efforts throughout the counties, but also making sure that we continue a legacy program like PI, which had been, as you all know, housed at Foothills for many, many years. We've also began to expand our own programming into Boulder County, specifically in Longmont. So right now we have our United for Families program, which I manage in Longmont, and that is our early childcare program. So we're really focused on birth to 5 years old. And last year we committed approximately $250,000 to early childcare in Longmont. Our partners include Salud, the St. Vrain Valley School District, and Wild Plum Center, as well as the TLC Learning Center. So we plan on continuing to expand the early childcare effort in Longmont. And then in addition, we hope to bring 2 additional programs into Longmont in the next year or so. And that's United for Business, which works with mainly minority and women-owned small businesses. And these are businesses that maybe have been in existence for a couple of years, and they know what their needs are. They know what their strengths are, and they know what their challenges are. So we have a program that comes in and provides technical assistance and business expertise, and essentially mentors or supports that business owner to stabilize, secure their business, potentially scale it, especially if they're adding employees, if they need a website, maybe some financial support. So we do all of that within small businesses, and we really do hope to bring that into Longmont. And then in addition, we have something called United for Schools, and we already started working with St. Vrain Valley School District on potentially working with Northridge and Columbine, 2 schools just east of Main Street, which is that neighborhood that we're really focused on, to help with chronic absenteeism in the schools. And the ways that we do that is we help to create, if it doesn't already exist, if it does exist, help to strengthen it, parent engagement structure in the school to get parents involved and engaged with the teachers and the school administrators, and really try to prevent chronic absenteeism in schools, which is 18 days or more missed in a calendar year. So those are some things that are coming. I can't really speak to, I don't think if Lisa was on the call, our grants manager, she could maybe talk to those numbers a little bit more specifically, but I do know that we have really been building our programming in Boulder County as well as our grant making.
Thank you, Gina.
Thanks, that's really helpful. I have a question specifically about the PI program that you've applied for here. One of the things I noted was that you, the overall, I guess, I don't want to call it success, but folks who utilize the funds, 12 months after they have graduated are still either in business or still own the home. I wonder if you could talk a little bit about whether that has changed with COVID, as well as whether you do any longer term sort of longitudinal to see what that looks like past the 1-year mark.
Mm-hmm. Right. So we've seen some changes in some of the things that people anticipate when they're finishing the program. I know that's like after they've been in the program and they're purchasing their asset. Some of them aren't as optimistic about being able to save. So we have this last year, 50% say that saving is a new habit, and 67% say that they've experienced an increase in income, and 86% say that they plan to save regularly after PI. So that percentage of being able to save regularly after PI is a little lower than we've seen in recent years. And also, we see that people sometimes are putting at 1 year after, they're putting in really big goals. And so it's not something they can really accomplish within 1 year. So those goals have, that percentage has gone down as well. But we're still seeing that people are really consistent in wanting to maintain their experience with PI. We did one of the three outcomes that have come out really strongly in our information, and we have an evaluation team that can look at our data and really pull out key themes, which has been really helpful. One is that PI really increases the financial awareness and education of PI participants. It provides tools to strengthen their economic stability, and it really increases their confidence and a sense of empowerment. So those are the three key themes that we've seen this year that have come out of PI. And we've also just finished doing a follow-up survey with some participants that graduated 7 to 10 years ago. And we're just finishing up putting together that report. But some of the key findings there have been that PI came at the right time for individuals in the program. They were facing a difficult situation, and it just was at the right time for them. It has really established a financial knowledge foundation and capacity that they still use today. They've shared budgeting and financial education with their children throughout the program. And they've also provided it has provided long-term stability and security for families. And it's also a shift in mentality of what was possible and who they could be in the future. So we've really seen a deep impact in families' lives. So I hope that answers your question.
Yes, thank you. Karen Roney.
So it seems like I ask this about every year, and every year it seems to get worse in terms of, well, I don't mean the trend gets more challenging. That would be a good way to say that, sorry. So for folks that are trying to save for purchasing a home,
yes,
given the continued increase in skyrocketing costs for home ownership, what impact is that having on the PI participants who have that as a goal?
Yes, we've taken your comments to heart, and we've thought deeply about this. So we do see some people that have decided it's not the right time for me to buy right now because of the way things are, or my income is not enough. So we've thought about this, and we've taken it to the advisory committee, and we're proposing, if the funds are available, to be able to possibly increase the opportunity for individuals in the community to save up, to have an amount of $10,000 to put towards their home purchase, because we understand that $10,000 for an affordable home is what is needed really to be able to purchase that. Because we're seeing, and we've reviewed the data from our past participants, PI participants are matching PI with other down payment assistance programs, like the Affordable Housing Program, down payment assistance program, like CHAFA loan or CHAFA assistance. You know the different programs, but so it's becoming, we're thinking it might become more like, rather than learning from the down payment assistance program, if they have to juggle two different programs, it's more like checking the boxes perhaps with the different things that are required. So we're looking into increasing that amount. It might be a tier program. Not everyone in the community can save $2,000 within 30 months, for example, or 6 months, whatever their timeline is. So it'll have to be based on budget. It'll also have to be based on the income that's available to the program to invest, and it might reduce the number of people that we could assist in a given year if that's the case, depending on our funding available. So those are the things that we're weighing right now, but we understand from our advisors that if we don't change things, then perhaps our program won't be relevant in the future.
Okay, Thank you for that.
And the only thing, Karen, I would add is that we do hope to implement this at some point during this fiscal year, because we work on fiscal years. So at some point, we hope to work with a small group of participants who are willing to save a little bit more. And then, like Rosemary says, it's a true 4-to-1 match. So, you know, if they save $1,500, they're going to receive around $7,500 for their asset total. $2,000, they're going to receive $10,000 for their total asset. So our hope is really to implement it with a small group this fiscal year and see how it goes.
Yep. Great. So the timer did go off during the response to that last question. So unless there is anyone else that is dying to ask a question of Gina and Rosemary, then I think we've concluded our 15 minutes.
Thank you both for being here this morning. We appreciate your time.
Thank you so much for everything you do for the community.
Yes, thank you all. We appreciate you.
Have a
Bye.
good day. Bye.
Bye.
So Mark is in the waiting room. We got another minute. We can wait, or I can let him in.
We could use $20 million.
We got some projects, Karen, that we want to fund.
Yeah. Didn't
Like,
know. I guess we weren't on the secret list.
We were not part of that secret list,
Holy moly.
unfortunately.
It's amazing to me too that they're like, oh, we're gonna essentially give away $10 million of it.
Yeah, so.
So there you go, Karen. We got some stuff that we could fund.
We're on the secret list.
We were
Darn
left out.
it. I think you can go ahead and let Mark in unless anyone needs to take a break or.
All right, I'm letting him in.
Good morning.
Hey, Mark, good morning, and welcome. This is the Housing and Human Services Advisory Board's hearing fundings for human services funding. Appreciate you being here. We're gonna have about 15 minutes. Karen will be our timer.
I think we actually have 2 programs. So
We have 2
Oh, that's
programs.
right. That's right. You get 30 minutes. My
Woohoo!
apologies. You get 30 minutes. Or I forget, Karen. I think it's 30, right? To 9:50.
Yeah, so, yep, we have Mark for 30 minutes. And I think what we did last time was that we, instead of just throwing it into one bucket, we did allow like 15 minutes for say childcare and then 15 minutes for basic needs. So.
Right. So with that said, I'm going to turn it over to Caitlin, and Caitlin will tell us if we're starting with the Aspen Center or the basic needs request. You can make that decision, and then we'll go from there.
Hi, good morning, Mark. Thanks so much for being here today with us. Since you do have 2 programs, like Karen mentioned, we've found it useful to specify which one we're focusing on just to make sure that we don't leave one in the with no time for questions. So I would suggest, or I'm going to say that we're going to start with the Aspen Center program. And then for the second 15 minutes, we'll do more of a deep dive on the basic needs program that you've requested funding for. So let's get started with Aspen Center. And I want to see if anyone on the board has questions about this program to get us started. Graham.
Thanks, Caitlin. Good morning. I am curious about the program evaluation and that section of your grant application. You talk about assessing the students for kindergarten readiness, but I'm not seeing or understanding how you might evaluate the program itself and make improvements. Could you talk about that, please?
Sure. Typically, we'll use 2 major indicators, if you will, to let us know, are we on track? Are we doing well? What do we need to look at possibly improving or getting better at? Again, one is the the school readiness programs that we use for assessment for the children. Our goal is to make sure that 100% of all the kids who graduate and leave Aspen Center and move on to the public school system or wherever, whatever schools they'll be going to next, that we're achieving 100% of kindergarten ready or school ready at that point. That's our major goals. We want to make sure about 50% of the kids who attend this school are from lower income households. So one of our major goals is to shrink that achievement gap. So we feel that if 100% of everyone who leaves our school is kindergarten ready, that we're helping do our part, if you will, to shrink that achievement gap. And then the second is through surveys with parents. I know our center director will do this once or twice throughout the school year. And then they have regular meetings with parents, whether it's one-on-one or as a larger school community. And there's always on those agendas the opportunity to discuss. And I've actually even been a part of a couple conversations where some concerns or questions have come up, and we've talked those through. We've taken that feedback back and incorporated that into our work as we move forward.
Thank you, Mark.
You're welcome.
Brian. And then Karen
Caitlin.
Phillips.
Good morning, Mark. A question kind of related. I'm thinking about 100% kindergarten readiness. And I'm wondering at what stage, or maybe better asked, are you able to identify learning disabilities or anything like that that would affect children's ability to be successful in the future at the stage that you have them?
Yes, definitely. We have a partnership with Child Find, with Imagine. If we've identified anyone that we believe this may be the case for, of course, we start with the discussion with the parents and help the parents navigate and understand, what we're seeing or observing in the classroom, what possible steps can be taken to move forward, and then helping them navigate if they need that assistance in which direction they would like to go with their child. We also have a partnership with Kids Connect with mental health partners. They've been in our program for the past year plus, and I believe that we're going to renew with them for this current school year. So we also have some of that built in for the social emotional components in the classrooms. We have a built-in, what I would say is a professional who can come in and help teachers navigate and create scenarios and an atmosphere to help those children learn and excel and also feel successful while they're in the classroom.
Great. Thank you, Mark.
You're welcome.
Karen Phillips.
Good morning. Thanks for being here. Under your scope of work, what does the special sessions look like that you offer? What does it look like, your special session?
Sure, and I'm hoping that I'm understanding what Elizabeth had in there in regards to special sessions. I know she oftentimes, it's been a little bit hit or miss with the pandemic, and the pandemic's affected our staffing, so it's affected our ability to provide additional supports and learning opportunities outside of just the classroom setting. But in the past, and she's starting to ramp these up again, especially with Kids Connect offering opportunities for parents to learn about specific developmental stages or strategies. They'll have a different topic, or they're working towards, and they're putting it back in place where once a month they would have a different topic. And we've been doing this all online, obviously, for the past almost 2 years now, but it could be a variety of topics and a variety of different speakers. Sometimes it may be one of our teachers or our center director, and sometimes we bring in experts from outside of the building to provide these opportunities for parents.
Thank you.
You're welcome.
Mark, I wanted to ask, one of the things that we have heard from most of the childcare providers and those dealing in early education is around the struggles around staffing. And I'd love to hear what you're doing at the Aspen Center to sort of address those challenges. And what we have heard is, really a shortage of early childhood education teachers and professionals.
Sure. I was hoping no one would ask that so we don't jinx us. We just hired the last opening that we had, and she's starting on Monday. So we're going to be fully staffed on Monday. However, it's been very painful to get there. I would say it's been at least 10 months, maybe longer, since we've been fully staffed at the Aspen Center. And as a matter of fact, this summer, we were hanging on by a thread. I mean, literally, if we would have lost one more staff, that could have been the house of cards almost, if you will, that would have fallen for us. What we had to do in that interim, so I praise my center director and I praise the staff that hung in there, because this was very difficult for them. And actually, we brought over our center staff for over a month to assist in things that we could assist in outside of the classroom to take the pressure off of staff. But the big thing that we had to do, unfortunately, is on September 30th, we combined our two preschool rooms to one, because we were still down 4 staff, and this would bring us down to just being down 1 staff. And as a part of that process, we had to disenroll 8 children. But the good news is we were able to connect each one of those families to a different preschool throughout Longmont that they felt comfortable with. So there was no gap in services for those families, because we knew how devastating that could be. So Junior Jets, Wild Plum, TLC Learning Center, we connected a lot of the families to those 3 centers to make sure that they had a place to go, if you will, October 1st. And I will also, and I'll finish up by just saying that I think it was more of a difficult transition for the adults than the kids. I mean, the kids were excited to go to a new school, meet new friends, and it was very difficult for the parents, for sure. But doing that alone and then hiring this one last staff, we're in a very good position as of right now, and hopefully we'll remain there for the rest of the school year.
Thank you. Karen Roney.
Sorry. So Mark, did you, so are you continuing then with a one combined classroom? So you, for the time being, is that correct?
Yeah, we're gonna stay with that for the rest of the school year.
Okay.
I think part of this too, part of the challenge is that leading into the school year, we started having enrollments. We were in pretty good shape staffing wise, and we thought we could hire the staff we needed. So we're almost a victim of our success, which I'm sure other preschools could say the same. Our enrollment's gone through the roof. And we've got people on a waiting list. We got kiddos on a waiting list for all classrooms for quite a while out. So we opened the additional room thinking we could staff it and we could help meet that need. And then we just couldn't get the staffing to catch up with our enrollment.
Yeah. Okay. That wasn't my original question, but I just thought I would ask that follow up. So I have 2 questions. One is, what is the status of the search for a different building for the Aspen Center? And then I noticed in the application there was a reference to a health equity plan as it relates to Aspen Center. So I'm interested in what's happening in that regard.
Sure. Regarding a new building right now, it is in our strategic plan, but it's the last in the order of goals, if you will. One of the big things that we want to make sure that we tackle first is paying off the Hour Center before we move on to taking on another large mortgage. And we've made very significant strides in that in the past year. And our goal is to pay the Collier building off by 2023, but I think we're going to beat that goal. And then that will put us in a position to have more serious discussions around taking on a new debt of that size. So I believe that we will start having actual discussions, serious discussions sometime in 2022, maybe about this time next year, fingers crossed. Regarding our diversity, equity, and inclusion plan. So through the Family Resource Center Association of Colorado, so this is kind of on the Hour Center side of things, they received funding from the Colorado Health Foundation, and that funding was specific for the network or the membership to create DEI plans and begin to move forward with their DEI work. So we definitely jumped on that opportunity. We saw a lot of value in that opportunity. And as part of that work, we incorporated the Aspen Center in with the Hour Center with our goals moving forward. So basically, we had finished that plan, I believe it was early August. We submitted that to FRCA and got the check off that we did what we were required to do for the funding that we received. So that part's done, and now we're moving on towards the implementation phase. And part of that includes we just reached out to the Colorado Health Foundation and requested funds for implementation now. So Colorado Health Foundation is giving FRCA, and I won't go too far into the details, but they've given them more money to bring out to the network for implementation. We're a basic member versus a higher member. They've got these premium plus members, and usually the pass-through dollars go to those organizations. But they did tell us that, or really encouraged us as basic members to go apply directly to the Colorado Health Foundation. So that's what we've done. We hope to hear in the next couple of weeks that we've hopefully been granted our request. But our big thing right now is we're moving forward with a January start date with a lot of our goals. We've hired a community outreach and equity coordinator. She's getting really acclimated to our work at the Hour Center and the Aspen Center, and basically getting her connections set up and getting her feet under her. And then in January, we'll be taking off in earnest with that program.
All right, great. Thanks.
You're welcome.
I think we have time for one more question around the Aspen Center, if anyone has one. Otherwise, we're right at the middle of time. So if folks want to look at the basic needs program, we can shift to questions about that. Any questions?
Hang on, I might have one. Well, I have to pull up my application. There's too many.
Give everyone a second to switch which application they're looking at if they need to.
So I do have a question on the childcare, if I can ask. So what is you talk about that, that you have a 2-generation program at the Aspen Center. So can you talk about what that looks like in terms of the Aspen Center?
Sure. So we've worked really hard, and we're gaining a lot of traction. And then again, as everyone's, I'm sure you've heard a million times, then COVID hit, but we were still able to continue to create synergies around the Hour Center and the Aspen Center. So as I mentioned before, approximately 50% of the enrollments at the Aspen Center either receive CCAP funding or sliding scale according to household income. And in many of those cases, as teachers, the trusted individual in their life is working with them, they may find out something around struggling with rent assistance or food or something else, and will help create a warm handoff back to the Hour Center. We also partner with Youth and Family Services of the City of Longmont with the Nurturing Parenting Program. So we can connect, and we actively engage the parents with learning opportunities like that. And then also we try to keep a couple slots open. So as our resource specialist team, which is our case management team, as they're working with families, and if they're discovering that childcare might be a barrier to their goals in regards to employment, et cetera, we try to make that connection with them in the Aspen Center, and hopefully it's a good fit, or the family feels it's a good fit for their child and their family, and we can help remove that barrier while we're working on other goals with that family. So the big part of what we've been trying to do is just create synergies between the two organizations that bring more wraparound supports to families who could benefit from that.
Great, thank you.
You're welcome.
Karen Phillips.
Good morning. Thanks for being here, Mark. I just had 2 questions. One is, how many resource specialists do you have, and how do people find out about the Hour Center?
Sure. So let me try to count here. We have one individual who does home study. We have one individual who does HSP. We have a part-time, and I believe 3 others. So that's about 5.5 to 6 resource specialists. We're actually right now going to hire another resource specialist. So we're going to have more resource specialists than we've ever had before. And the main reason for that is the need is not going down in our community at all. And we're very, very close to securing a very large amount of money through Energy Outreach Colorado. And for us to process the amount of households that we would expect to come to us, we need to bring in another resource specialist. Otherwise, we're going to be 4 or 5 weeks out with appointments, which doesn't do a family any good if they have to wait a month to come in to see us. And then in regards to getting the information out or doing outreach, a lot of that is word of mouth through a lot of the families that we work with. I know oftentimes that they will refer friends, family, neighbors that might be struggling to come check out the Hour Center. We're very well plugged in with the safety net. So we do a lot of work with our safety net providers, including the city and the county. And then whenever we have the opportunity, we're out talking in the community at speaking engagements. So it's not uncommon that I will do 1 or 2 speaking engagements a week, churches, different groups. And it's not always just me. It could be our program director. It could be our community outreach and equity coordinator. She's out in the Latinx, communities right now and meeting with those different informal groups out there and talking about what the Hour Center does. So we're accepting speaking engagements, and we're going out and actively going into the community and talking with different groups at the same time.
Thank you.
Welcome.
Deanna.
So I don't know that I have a question so much as I just want to, it looks like you have worked really hard to diversify your board. And I just wanted to commend you for those efforts. It seems like we have this conversations a lot with people about diversification of boards, and it doesn't necessarily change year to year. So it's just refreshing to see that the numbers have changed on your board. It's obvious that you've worked really hard to change those numbers. So clearly it can be done. And I just wanted to say thank you for doing that. And it is a factor that we consider, and it is important to us. So thank you.
Thank you. I appreciate that recognition. I mean, we're working very hard to make sure this isn't lip service, that we're actually making changes to the culture of our organization from all levels. So I appreciate that, and I will pass that along to our team. Thank you.
Graham.
Thanks, Caitlin. I kind of have a question that segues into the next program, if that's all right. Mark, in line with Deanna's comments, it does look like you guys are doing a lot of work in the basic needs services for DEI. And I'm just curious as to, maybe you could let us know 1 or 2 changes in how you conduct business day to day with basic needs that has increased equity and inclusion, and yeah, just maybe talk about that a little bit.
Sure. It's hard to make big changes over a short period of time. They're going to last. And those are a lot of things that we'll be working on starting in January, but some smaller things that we've started, kind of grabbing for the lower hanging fruit to get some momentum going, if you will. Basically, at this point, all of our community facing staff, so our front desk, our resource specialists, our intake specialists, are all bilingual. So no matter who happens to answer the phone or who you meet with, they have the opportunity to connect with someone that's either English speaking or Spanish speaking. We understand that there's much more than just 2 groups in our community, and that's part of the bigger project that we need to work on. So for instance, we're starting to connect with Language Link, which will give us the opportunity going into the first of the year that if someone comes in, let's say to the front desk and speaks Nepalese, we can call this line, and it's not really convenient, but we can at least have someone on the phone who can be doing translation services between our staff and that community member. And I want to say it's like close to 100 languages that they offer. Once you call up and say what you need, that's available like almost at the touch of your fingertips there. We also are, so for instance, you may or may not follow some of the videos that we send out about once a quarter. One thing that we're working on right now is our next video talking about the Hour Center. We're going to make sure that we have subtitles. So if it's an English speaker, it's going to have Spanish subtitles. And we're not just having all English speaking presenters on that video. We're going to make sure there's at least 1 or 2 Spanish speaking and flip it and have English subtitles. So again, it feels a little bit more inclusive than just saying, well, we'll do the Spanish subtitles at the beginning. We've also, all of our materials now have been translated into Spanish. Some of our goals going into next year is adding that button where you can translate the entire website to whatever language that you need. So there are those kind of projects as well on the horizon. So we've kind of gained the low-hanging fruit at this point. We're going to go for the bigger items going into 2022.
Thanks, Mark.
Madeline.
Hi, Mark. Thank you for being here. I would like to know if Kent Ware is still on your board.
Yes, he is.
Great. Because I'm the person that recruited Kent, and I know he's served faithfully. He's served faithfully for some years now. What efforts are you making to increase African American participation overall?
So we have 2 African Americans on our board right now, both Kent and Anita Ware, or Kent Ware and Anita Thomas. And again, it's when our board is doing recruitment and when we're speaking out in the community, there's that conscientious awareness of, we're looking for diverse perspectives across the board. That would include the African American community. So basically it's a matter of our leadership, board and staff leadership, always having that in the back of their mind when they're speaking with individuals, when individuals are showing that interest, that we make sure that we open that door fully and make that opportunity available.
Very well, thank you.
Other questions? Brian.
Got a technical question, and I think it's just my failure to understand, Mark, on the budget. There is, so the agency income from the City of Longmont is about $324,000, and the expense for this program is $100,000. Aspen Center, I think, is $17,000 is what you have as your request. Just so I understand it, is the rest of it, I assume it's not housing related, or like what is that other funding? Just so I can kind of understand the mix.
Sure. So without having everything right in front of me, I think I'm gonna take a stab at what I understand your question to be, and if it's not, please let me know. So we receive Homesteady, which is a different grant and different funding, and we capture a lot of that there. And then the funds that we receive through these grant requests, we treat them like general operating. So they'll come across as supporting some of our resource specialists. They might go in towards direct financial assistance, and then some may go into the overall operations of the organization. Oftentimes when they're not specially designated when they come into the building, it gets to be very hard to track. We certainly can, if this group said, we really want to see a breakdown, we could always do that very specific breakdown for this committee. So I hope that answered your question.
That did, thank you. And I'm quite certain this group is not gonna ask for that, but
sure.
Thank you for offering.
Sure.
Karen Roney.
I'm also assuming that some of that might have been from some of the CDBG dollars that you would have received in 2020. So yeah, there were several pots, several city sources in that 387K. So you talked a little bit about this, Mark, when we were talking about the Aspen Center, but the new position that you have brought on, so the outreach and
equity coordinator.
Equity, thank you. so talk about what this position really is going to be focusing on.
Sure. The 2 main thrusts of this position are, one, this individual is going to work with me to make sure, again, that the EDI plan that we've created is an active document, is a living document, and we're working towards those goals. I mean, oftentimes strategic plans, fundraising plans, et cetera, get made and then they're put on the shelf and collect dust. This individual is going to be working with me to make sure that we're moving forward. Part of that is we're going to have an EDI committee. So we're going to have community members and participants that are also holding us accountable to this work. And Iris is going to help work with this group specifically and help make sure this work moves forward. So there's that element. And the second thrust is being out in the community, making, the connections. So, as much as we think that we're really well connected across the board with all segments of the community, whether it's, ethnicity, race, gender identification, sexuality, there's a lot of areas that we're not very well connected as an hour center, and either one, individuals don't know about us, or two, they might not feel comfortable coming to us and requesting assistance. So Iris will be doing a lot of the work of building those bridges throughout the community and hopefully building that trust. So again, if a household really needs assistance from a particular part of the community that for whatever reason has not felt comfortable or known about us to come, that we'll build those bridges so those individuals hopefully won't hesitate and come to the Hour Center and ask for the assistance that they might need.
And then, Caitlin, I have one last question, if that's all right. So, so Mark, you did talk about that you have been able to hire additional resource specialists, and you probably will be hiring another one with this Energy Outreach Colorado funding that has come in. So what's your time frame right now for wait time for someone coming in and requesting assistance to that request and them being able to see someone in intake?
Sure. So right now we're about 3 weeks out. We have 2 resource specialists that are new in their position and almost fully up to speed. So we expect that either the end of this week or the beginning of the next week that they will start carrying a full caseload. And when they do, that should bring us down to about 2 weeks. And that's what we strive for, is between 1 and 2 weeks. And then this additional position that I'm referring to, the moment we get word that we've been approved for our EOC request, and then we start working with the city and the county and our partners to let the community know these funds are available, we expect calls to be coming in left and right. So we're hoping to get this other position filled so we don't go from 2 weeks to 4 weeks overnight, right, that we can stay in that 2 to 3 week window the best we can.
Great.
And so, oh, sorry, go ahead, Karen.
Like minute left, I think. Yep, about another minute and a half.
All right. Any other questions, or should we let Mark wrap us up with something that we may not have asked about or that he thinks we should know? We'll give you that minute and a half then, Mark, to wrap it.
All right. Well, one, I just want to say thank you to all the hard work that you're all putting in. I know you're putting a lot of time into this, and you're spending your Saturday morning doing this to support the community. So thank you all for the time that you're dedicating to our community. And I think I would just wrap up by saying we're far from seeing the end of whatever this pandemic looks like. At the Hour Center, we're planning on well over $1 million over in direct financial assistance that we're going to provide again this year. The only difference may be is we're not writing the checks as much this year. The funding has pivoted a little bit because a lot of these are federal dollars. City of Longmont, Boulder County, and some other organizations are writing the checks because they're better equipped to handle federal audits. But we're still doing the screening, the referring, the paperwork. Basically, we're doing everything but writing the checks. And I wouldn't be surprised if we're at about $1.5 million by the end of this year. Again, in regards to direct financial assistance, which is basically rent assistance and utility assistance. There's other funding categories in there, but those are by far the 2 biggest needs in our community. And we're not seeing this slow down 1 iota this year. So just throwing that out there, it seems kind of like things are a little bit back to normal, but we got a long ways to go. So the support that you guys provide, the City of Longmont and others, is instrumental in us being able to do this. So thank you.
Okay, that's it. That's time.
All right.
Thanks so much, Mark.
Mark. Thanks, guys. Have a
Thank
great rest of
you.
your day.
So I think our VIA crew is in the waiting room, and I will be leaving at 10 o'clock. So turn it over to Caitlin and Karen. But I'm gonna go ahead and let them in.
Okay.
Good morning.
Morning.
Good morning.
Just waiting for Bill to connect. I think, can you hear me, Bill? Well, we're gonna go ahead and get started because our time is short. So welcome Lisa and Zoe and Bill to the Housing and Human Services Advisory Board Human Services Funding hearings. I know you have 3 programs. I think you're still getting 30 minutes. Is that correct, Karen? I think we kept it at 30.
I'm looking. Nope, they got, no,
40.
they have 40 minutes.
Yeah, 40 minutes. Yeah, you're gonna have a 40-minute time frame to answer questions from the board. Caitlin, our chair, will be facilitating that. Unfortunately, I have to leave in about 7 minutes. But I will be part of it for the part of it, and then Caitlin and Karen will take over. All right, I'll turn it over to Caitlin.
Hi, good morning, everyone. Thank you so much for being here. Before we get started with questions, I think we've got a few folks on the call. It'd be great if you could give us, a quick introduction so we know who you are. Lisa and Zoe.
From VIA,
Oh, sorry.
So our
Sorry about that.
3 VIA participants, if you would introduce yourself.
Yes, I'll go ahead. I'm Lisa Bitzer. I'm the Director of Operations at VIA.
And I'm Zoe DeVito, and I'm the Development and Partnerships Manager at VIA.
Okay. And then it looks like we also have Bill. Do you want to let us know who you are, Bill?
So I'm not sure if Bill's having some struggles. He fell off earlier, so I'm not sure if he's gonna fall off again.
Okay, no problem. So we've got 3 programs in about 40 minutes, and I want to make sure we have time for each of them. So what I'm going to suggest is that we take we sort of cordon off about 10 minutes for each of them, and then we'll have a little overflow room there with it. So let's start with the paratransit. I'm just going to sort of go in order and just to help keep folks focused on which one we're working on. So for the board, we'll start with paratransit. And if anyone has questions to get us started with the VIA folks. Brian.
Thank you, Caitlin. Good morning. So Caitlin, one clarification. Because of the 3rd program interaction with the market, I will recuse myself from any discussion on that. I just wanted to be clear. So my questions are very technical in nature. I was just reading through the budget, and I noticed the agency budget doesn't have any funding from the City of Longmont, but the program budget has $185,000 for I think the paratransit, and then 11 or 12,000 for the other one. So I'm assuming that just didn't get included, but I wanted to make sure there wasn't something I was missing.
I'd rather Bill answer this one if he.
Yeah, can you all hear me?
Sure.
Okay.
Yeah.
Had a little issue getting on there. We do get funding from the City of Longmont, obviously, and so I'm not sure exactly, without looking at the portion you're looking at. We do get funding from both transportation and human services, and
yeah, I think what Brian is indicating is that it was included in the program budget, but not in your agency budget, and it should be in your agency budget too.
Okay.
Is that correct, Brian?
Yeah. So like I said, it was a technical question because I think it's understood that it's in both, but it might be helpful just to put it in there when you have an opportunity. And I did have one non-technical question. How is the labor market, particularly your volunteer situation, looking for your drivers and services? And I've got a little bit of insight into that, but I don't know if it's changed recently.
Yeah,
Go ahead,
Lisa, you go.
Okay, so the labor market, especially for our paid drivers, is tough, as it is for everybody's it seems like everywhere these days. We're doing the best we can. We've got a new HR manager that has been doing a fabulous job getting our needs out there on all the social media websites and everything else to hire. It's a tough job for a driver to do, and it takes a special person to be able to deliver that door-through-door service that we do. So we gain a couple, we lose a couple. As far as the volunteer drivers, we did pre-pandemic had 25. We are now down to 14. And due to the pandemic, a lot of them just didn't feel safe coming back and driving. But a lot of those volunteers are doing the food delivery all over, not only for the Boulder County Farmers Market, but for community food share, the seniors in Lions, and other things. So we are still trying to ramp that service up as well, and giving people the difference of being able to either take people if they're comfortable with that, or being able to go ahead and do food deliveries. And I'm happy to report that all of our volunteers are vaccinated 100%.
Great. Thank you, Lisa.
You're welcome.
Graham.
Thanks, Caitlin. Good morning, Lisa, Zoe, and Bill. Thanks for being here. I'm looking at the program demographics across all three, and I'm noticing by far the folks you serve are white and in the 80 to 100% AMI, so median income. And that's a bit of a red flag for me, and I'm wondering if it is for you too, and what you might be doing about that.
Sure. Right. I can talk a little bit about that. While yes, the majority of our clients are white, it represents a lot of the general demographics of the area, to my understanding. And there's some of our other programs that our partners have reported are serving more Hispanic families. For example, with the farmers market, I believe our friend Nikki said that there was about a 40% increase in participation in programs with Latinx households because of the delivery capability. And so, yes, we recognize that there are definitely more than white people who need services for sure. And we tried to creatively reach these other households in the way that makes sense for them.
Could you give me some examples of ways you're trying to reach out to those minority or underserved communities?
Sure. Lisa, do you want to talk about the Latino Outreach maybe?
Yeah. So we joined the Latino Chamber of Commerce. That was a wonderful entrance into being able to connect with the Hispanic community. We also have hired all of our mobility specialists. Half of our reservationists are Hispanic as well, so that they can meet that population. We are also starting to go out now that COVID is, starting to open things up. We're doing meetings with, agencies, senior centers, things like that. The Longmont Senior Center has been a huge supporter, helping us out. Also doing, reaching out to the Hispanic community to take people to their vaccine appointments. And so we continue to keep striving in that in that area to be able to alert everyone that we are here for everyone, to be able to provide service for their needs.
Thank you.
Madeline, and then Deanna.
Yes, and good morning, and thanks for being here. In listening to you, you referenced Latino, the Latino community. What about the African American community, the Black community?
Extremely important. We joined the NAACP this year because we recognize that we need some guidance on reaching more African American and Black individuals and households. Our Human Resources Manager, Brittany, she is our chair, our representative with NAACP. She's a great person to have in that position because not only does she help to give us insights on how to better serve clients, she's also right in there with hiring. And so it's helpful for our workforce as well.
Hey, Deanna.
So on the same theme, I'm just noting, because I was on the committee last year as well, that I see from my notes that last year you had formulated a DEI staff committee. And I'm just wondering what results you've had from that committee being formulated, and specifically with regards to board membership. I know that was one thing we discussed last year as well. And if you have any, I know things take time, so but I'd just like some information on sort of where those efforts are going, and if you have any long-term plans, strategic plans for how the DEI committee is going to work to improve diversification of your board overall.
The DEI committee was pulled together, I think, for a couple of meetings, but we don't have any sort of long-term strategy for this. And so the way that we can bolster that is with our Human Resources Manager kind of taking the lead on that. And so we do need some work on developing the DEI committee, yes.
So I guess I'll just follow up to say too, that obviously if you're successful in diversifying your board, I think you'll be successful in outreach to the community, right? Because board diversification will help you figure out how to reach underserved members of the community. So I would just say I fully support those efforts and would encourage you to do that. So that's all I will end with.
Thank you, Deanna. And we did recently add on 2 new board members since we have submitted our application, and one board member is Latina and the other board member is African American. So we are working on that diversification process.
Thank you.
I might add to that as many of you may know, we took on the Paratransit for another agency in the Denver Metro that decided to get out of that transportation and go back to kind of their roots of adult daycare. And it was about an equal amount of transportation that we do in Boulder County, Northern Adams, and Southern Larimer. So it was a huge bite for us. But what it's doing is it's opening up our region more for diversification of in many ways, geographically and demographically. And so we are actively looking for additional board members in the Denver Metro that can help with all of these issues.
So Caitlin, the timer did go off for this particular program.
All right, our second program, it was the Via Mobility Options program. So if anyone has questions about that one, I'll give folks a second to switch which evaluation or which application they're looking at, and then see if there are any questions from the board on this program. Madeline, you've got your electronic hand up. Did you have another question?
I did not. I just forgot to lower it. Thanks.
Okay. And then Brian, did you have something?
I popped it up and then back down to indicate it wasn't really a question. I actually combined all of my questions for the two programs into the first section. So
Understood. So let's see. I apologize. Any questions from the board or staff on this particular program?
So I do have, actually, it's really more agency questions. So can I ask those now?
Yes, absolutely.
Okay, so the you did have in your application, that you waived rider fees during the pandemic. So, and I know the rider fees isn't a huge source of revenue for VIA, but I'm just wondering if you have still suspended those, or when do you think that you might bring those back into the mix? And what kind of impact did it have on continuing ridership during the pandemic?
I guess I can answer that one. Fortunately, during the pandemic, we did have, unfortunately, the ridership was way down, but fortunately, we did have other sources of revenue from CARES, CRISA, that in fact, Longmont was very generous in giving us some CARES money just at the end of last year. So all of that helped us through that time of COVID, and we did suspend fares in 2020. We decided to do that again for 2021. Our board is taking up that issue this coming week at their monthly meeting about, whether we should reinstitute fares or, again, I mentioned the Denver Metro service we took over. They had never charged fares, but they'd been better at promoting rider donations. And as you know, or may know, Title III funding does not allow us to solicit or make it look like, well, you're paying a donation in lieu of fares, but people do voluntarily donate, and it's a reasonable amount of funding. Doesn't quite overcome the fares. We haven't been as successful in Boulder County with that. And I think that's what we want to discuss is, could we be more successful in communicating to riders that, hey, this is mostly funded, but the fares help, and donations in lieu of fares could also help. So we're still undecided on 2021, but we would like to find a way to make up at least a portion of that fare revenue.
And then when you reference your service expansion to the Denver metro area and Firestone, so I'm assuming that is basically the service that you took on from the other provider, or is there more expansion in the horizon for VIA in the Denver metro area?
Yeah, the 4-county, Jefferson, Denver, Adams, and Arapahoe were what we took on in the Denver area. The Carbon Valley service is being largely funded by the Carbon Valley towns. And that's been really a nice addition. And, some number of those trips go back and forth from Longmont. But that's been a great addition, and just something that came along through some of the outreach. And I should let Lisa talk more about that.
Thanks, Bill. Yeah, we have been running that service now for about a year. Started with the town of Firestone. Dacono then joined, and then just recently this month, on the 11th, Frederick joined in as well. And it's a nice gap of providing services to a place that really didn't have much transportation service, and bringing them into Boulder County, which at this point, it seems like Longmont is where people want to go. It's where the hospitals are. It's where medical treatment, Walmart's, all that kind of stuff. So it's been very successful. And then we just recently started a pilot till the end of this year, also for Northern Weld and parts of Larimer County, into Milliken, Meade, Fort Lupton, Lochbuie, those areas, Platteville, Johnstown, Gilchrist, and also serving that area up there and bringing people into Longmont and Boulder County as well, because they need medical assistance, and a lot of them have those medical programs or therapy in Longmont, or to be able to go shopping. So we're hoping to be able to get funding to keep it going in 2022, but it was a good way to find out, is there a need, which definitely there is. The numbers have been fabulous just in the short time. It's only run since the beginning of August of this year. But yes, you know, there is plans to, as we can and as we have drivers, that's our biggest problem, got to have drivers to drive the buses to provide the service. So that is really the thing that's sort of holding us back a little bit from doing some other things, because we just don't have the staff to be able to make it happen.
So is it fair to say that the greatest demand is for the medical trips?
Yes, medical and grocery, but
And grocery?
Definitely medical, yes.
Yeah. Thank you.
You're welcome.
I have a question about the logic model for the mobility options. One of the things that I think you talk about in the program overview is the mobility options providing more independence for folks. But the logic model is really focused on just the number of trips. And I wonder if you also do any surveys or other analysis of how those trips impact your, you know, the customers of this service, your clients.
Yeah, for the mobility folks, I have 3 of them. We do a survey overall for the company, but we do collect information at the time when people are calling. Are they looking for other avenues of transportation? We realize that VIA can't be everything for everyone. And so being able to give these people their independence, not only do we go ahead and sign them up for VIA if they're eligible, but then we also talk about all the other options that are out there, help them with the phone numbers getting through, maybe even calling up the other company and having a conversation about what the needs are, because people need their independence and they need to get to where they need to go. And so the mobility specialists are very good at that. Like I mentioned before, all 3 are bilingual so that they can both in English and in Spanish. And they do a fabulous job. And since the pandemic started, and taking over the other Denver Metro service, their numbers have really jumped up. You know, they used to register about 100 to 125 people. Now they're in the 350 to 380 range is the norm per month. The phone calls have more than doubled. They used to average about 1,000 incoming phone calls. They are now in the 2,000 to 3,000 incoming. So the need is there, and not everything is for finding transportation. They may need to know, who do they go to get food? Who do they go to, you know, for housing? So those kind of things. So they're really a one-stop shop to get everything done and to get people where they need to go. And if they don't know the answer, they will certainly find out and call the people back and let them know.
Karen Roney.
So can you talk a little bit about the really the trends that you are seeing in ridership, you know, beyond what has happened with COVID, and how has that influenced your agency's strategic plan moving forward?
I guess I can start with that. When 2019, of course, was you know, so far our biggest year, and so we kind of compare ourselves to that. Once COVID hit, and it was almost immediate when the stay-at-home order came out in mid-March of 2020, we dropped on every service we did: paratransit, transit, microtransit, everything, to about 20% of 2019 levels. We are currently back on most of our services to about 70% ridership. But we've noticed lately, we were looking at numbers for Longmont prior to this meeting, and I think we had 35,000 trips in 2019 in Longmont. We're on track for between 27 and 30,000 this year. But if you annualize what we've been doing in the last couple of months, we really are kind of back to the pre-COVID levels within the city. So that's all good news. Strategically, we we want to use our basket of funding to provide as many trips as we can. We still are not filling the entire need. We, on a weekly basis, region-wide, we're running about 200 denials a week. So there's 200 trips we can't do. And largely that's a function of operators, drivers that, we don't have. And we still have a little bit of funding flexibility yet. We still have some funding we could apply toward a little bit more service if we can just get operators. So we work so hard at that, so very, very hard at getting new folks. And in fact, we just raised our wages across the board. The average driver has, over the last year, gotten nearly a $2 an hour raise. And we're spending as much as we can to recruit and retain our operators.
So the buzzer went off for that particular program. So we're ready to go into the final one, I believe.
All right, which is the food delivery. And Brian, are you planning to stay in for it, but just not participate? Is that?
I am going to mute and turn off my camera so my facial expressions do not somehow sway people.
Okay.
In a manner, yeah.
Fantastic. Thanks for clarifying. All right, great. So we've got just a few minutes left, and the last program is the food delivery service, and this looks like this is the partnership with Boulder County Farmers Market. So, Karen, I see you already have a question.
I do. So, I guess the general question is what possessed VIA to get into the food delivery, prescription delivery? I mean, we saw VIA in a role that we've never seen before, that I recall. I think it's refreshing, so I want to commend you for that. And I'm just curious the thought process that went into that. And then you're asking us money to back up what you are, your innovation. So talk a little bit about that, if you will.
I guess I can start with that. Being the director of operations when the pandemic hit and ridership plummeted, we started to see a need. I was getting phone calls from people saying, we need food. We need to get food to all these people that are afraid to come out of their homes or can't come out of their homes due to health issues. So in the course of a week, we switched gears. I decided that we would start delivering food. One, it serves a multitude of purpose. It keeps some drivers busy because we did have to put a lot of drivers on furlough with unemployment, job attached, but I could keep as many as I could that could deliver food to all these people. The Boulder Farmer Market has been an amazing partner with us. As has Community Food Share and others. And it was the need. The need wasn't getting from point A to point B, it was getting food to these people. And nutritious food, that, not just garbage, that, they need to have good vegetables and things like that. So it jumped fast. We were ready. And we went ahead and we deliver a lot of food to a lot of people. It continues to grow all through 2020, all through 2021. And in fact, I just had a email from Mickey at the Boulder County Farmers Market this week that said, we have 100 more families that need assistance. Can you help? And it's like, one, I got to be careful with the funding. Two, I've got to be able to have the staff that can make this work. And so, you know, at this time, I don't know if I have the staff and you know, I can't just, we did a lot of it, you know, that we did it with no cost at the beginning because we just wanted to be able to serve the community and make a difference and get people what they needed. So we went from moving people to moving food to moving prescriptions, picking up at Walmart, Safeway, King Soopers, wherever, bringing food to them. And that continues, and it only continues to grow, which sort of surprised me. You know, I thought as things start to open back up and people get out, you know, they'll be willing to go to the grocery store, get what they need. And I'm not finding that that's the case. People are still wary. They don't want to be in big surroundings with lots of people still. COVID is still very much in our communities, and especially to the older population or people with health disabilities that are very careful about that. So I think we did a fantastic job of switching gears to meet the need of the community, and that's what they needed.
Yeah, I have a couple points to add also to that. We're finding that, you know, aging in place is very important for older people. We want them to stay in their homes forever, as long as they can. So we find that food delivery helps with that. And Boulder County AAA is really supportive of this. I know that we didn't put down a whole lot of program income because we haven't confirmed it yet, but we are expecting them to be a partner in this pretty soon. And I wanted to share too that the Colorado Association of Transit Agencies awarded us an Innovation of the Year in 2020 for this program. So we're happy to share that.
Did they give you money?
No. Just a good pat on the back, which is great.
I'm curious about, you know, Lisa, you mentioned the demand for this is growing, and obviously that, you know, you moved really quickly for this. And like Karen said, I really commend you for really seeing that need was in the community and that was something that you could help with, particularly with the staff you already had and the resources. I'm curious how you would say this has impacted your overall agency sort of strategic goals. Obviously you're here, people are demanding it more. This is this may have, I don't know for sure, but this may have started as hey, this is a temporary need. How are you adapting to this changing need and thinking about that in terms of where the agency will be in 5 years?
Right. Great question. Yeah, we adapted quickly, and I honestly don't see it going away. I see that this is something that VIA will do long-term because the need is there. Especially as long as COVID is out there, and people are fearful or they don't have the means in which to get to the food that they need. So it'll be a combination of VIA moving people and VIA moving groceries to people. And I honestly, my goal is to see it be long-term, as long as we can get funding for it to keep it going. I mean, we use a lot of our volunteer drivers for this program. An average volunteer on Monday morning will deliver 35 households each to give them their food. So that's a lot. It takes about four hours to get that all done per volunteer or paid driver. It's rewarding. It serves a purpose that's obviously desperately needed. I would be proud if VIA kept it going long term.
Karen Roney.
So that was kind of my question, Lisa, that you answered. Because it looks like you're looking for about 100,000 more or less to support this program. So my question was really around, is this a program that you imagine that volunteers will pick up more of that responsibility? And then does that bring the cost of the program down. So, and assuming then you're using your smaller vehicles, or or you're reimbursing them, volunteers for their, for their mileage. So anyhow, so I'm just looking at how you are envisioning this program moving forward. If you do imagine that it's going to be, an ongoing service to consider to try to get that cost as low as possible.
Yes, of course, to use volunteers is amazing. Even though we only have 14 at the moment, they do a phenomenal job for us. I would love to get us back to pre-pandemic levels or higher, which was 25 to 28 volunteers. We have a fleet of our own vehicles. We use the Priuses to deliver food, put down the back seat, and we load those cars to the ceiling, and a couple of other vehicles to deliver all this food. Also to other areas. It isn't just the Boulder County Farmers Market, but it's also, we take twice a week trips down to the Lions Senior Center down there and bring food to them that comes from a catering company, and we bring that down to them. We also do the Boulder County Housing Authority. We bring food to them. Every other week, we worked with EPA and the Community Food Share to bring food to the people there that can't make it to their facility to do it. So we do that on a weekly basis. So although the Boulder County Farmers Market is absolutely the biggest piece of it, and they do a lot of homes in the Longmont area, and also other areas in Boulder County. Yeah, to do it as efficiently as possible is always the goal. But at the same token, if you can't get volunteers to do it, then you have to pay paid drivers to do it, to be able to make it work, because once these orders are put in, we have to deliver. So it's not like, oh, sorry, 2 volunteers called out and now we can't deliver 70 households of food. We have to be able to make that work. And using our vehicles, insurance, gas, although cheaper with the Priuses for sure, but things like that. And then of course we do reimburse our volunteers if they use their own vehicle. Right now, I only have 2 that do that. The rest use ours. And we reimburse them 50 cents a mile. And I believe at this point, I only have 1 volunteer that's looking for reimbursement. The rest of them, the other one said, no, I consider it my help to via. So yeah, and I think it's going to grow. Right now I'm saying we average probably around 500 trips for food with all of what we do with food, and I can see that going higher. I don't see this going away. Neither does the Boulder County Farmers Market and the others. Oh, you're muted.
So the buzzer went off for program number 3. So we have concluded our 40 minutes with VIA.
Thank you all very much for your time. We really appreciate you spending your Saturday morning with us.
Thank you very much. We appreciate it.
Yeah.
Bye.
Thank you all.
All right, is everybody ready to move on? Okay. I will let Gina in the room.
I didn't listen, just so you know.
How are you going to prove that? We have to trust
Because
you?
I don't remember a thing you said.
I'm not sure that that's proof, Brian.
Yeah. And how did you know I even asked anything?
I guessed.
Ah. Good morning, Gina. How are you?
Good. How are you?
Good.
So,
so we have 15 minutes that we have set aside to ask you questions and for you to provide us answers. And I'm going to keep the time on this. And Caitlin Abbott is our chair of the advisory board this year, and she is going to facilitate the Q&A. And I think that's it.
All right.
Are we ready to roll?
I think
Hey.
so. All right. Hi, Gina. Welcome. Thank you so much
Hi.
for being here on a Saturday morning with us. As Karen said, we've got about 15 minutes for questions. So I'll kick it off and see if the board, if anyone on the board or staff have questions to get us started. Brian.
Thank you, Caitlin. Good morning, Gina. A couple of questions, but I'm going to start with just the one, which is, can you talk a little bit about the VOCA, VOCA funding, federal funding, and it sounds like you mentioned it is expected to decrease.
Yeah.
I just wanted to get a little better sense of that and your expectations for being able to make up for that.
Yeah, this is something that is weighing on the minds of a lot of victim service providers everywhere across the country. You can read about this in the news, so I won't go into too much detail. Basically, the program was a little bit broken because of the way they were accounting for fines and fees paid in by perpetrators at the federal level. When they changed from to do more sort of pleas and things like that, the fines and fees paid after pleas were went into the general budget instead of, or into the general fund instead of into this fund because of the way it was written. That's the quick answer of why the fund started to deplete. And they did a VOCA fix. So if you Google VOCA fix, you can read about it. And we worked really hard to get that VOCA fix. So the VOCA fix happened a couple months ago. But the problem is it's going to take a little while for them to rebuild those funds. Now, there's all sorts of things in play for the fund to try to fix, even in the interim, to try to rebuild a little bit more so that organizations like Blue Sky Bridge, but all the victim service providing agencies that get this funding can continue to receive it at the levels we've grown accustomed to. But we are being told to expect about that amount of potentially up to 20% decrease starting in 2023 and 2024. So for us, that would be about $100,000 a year for those 2 years. And then after that, it should be built back up and we should be able to get back to where we are. Now, that said, we are, to pat myself on the back, we are a Dream VOCA partner. And so they have come to us many times over the years and said, can you take this additional funding? In fact, we just finished some additional funding that they had to spend, and they asked if we could spend it. And we're like, yeah, we can spend it. So I do think that, I mean, we're just anticipating a 20%. We're hoping it'll be less. And we are working strategically with some individual donors and with some foundations to fill that in once we know. So it's going to be a stretch. I'm really hoping and praying that we don't have to cut any programs, because that's really what this will come to, is having to slash. And that would be the worst thing for our community. And it's pretty scary I mean, you're gonna hear this over and over and over, right? I'm sure you already have. We're all trying to figure it out. And because we have accepted so much VOCA funding, we used to get $40,000 and now we get $500,000 a year. And that's enabled us to grow and do so much more for our community. And yet it's scary. So we're working on it again with some individual donors that could help us for those 2 years. And luckily we do have a couple of people that might be able to, I mean, not to the level of 100,000, but that could help us to shore it up a little. We also have significant reserves. And if we need to, we could deplete those, but we know that's not the healthiest thing for the organization, because if we run into a significant economic downturn, which we all know might be coming, we may need to rely on that for other reasons. So, you know, I'm a finance person, so that's the way I think all the time. So needless to say, I'm working on it.
Thank you, Gina.
Sure. Gina, I have a question. I'm looking at the, you know, sort of the narrative around the DEI work that the organization has been doing, and notice that you've done, for example, coaching with employees based on evaluations that they did. I wonder if you could talk a little bit about any changes or things that have come out of those sessions in particular that have impacted how the organization operates, or that sort of thing. If you could give a couple of specific examples.
Yeah, so this has been really exciting and fun. for me for the last few years, but for a bunch of us that have been really diving into this. And over the last year, I would say I've seen the biggest shift. So our work directly with Maria has helped me to see, me and the others that have been doing this direct work has really helped us to really pinpoint where we are in our growth and our development in this area. So as a human, I'm learning a lot, which has been great, and trying to do it on my own was harder. So that's, I realize, not very specific. So what I've been able to put in place is I just signed a contract to put a 3-year DEI strategic plan in place. So I'm going to be working with Maria and with Dr. Ariana. Oh my God, sorry, I'm having a problem at the moment. It's Saturday. She's amazing. She's working with, so I have 2 people. We're working, management team is working with Maria, and then this other amazing woman who from CU is working with our BIPOC staff as much as they are interested. We have a support group, basically a peer group in place, which has been amazing. The feedback we've gotten has been very positive and then some one-on-one work as well, where our BIPOC staff has been able to do some leadership training work very specifically, and then also do some peer related work helping to so for instance, one of my staff members runs our MDT, and so she wanted some help to help her to be the best possible leader she could be on the entire multidisciplinary team for Boulder County. And so that's one very specific example that came out of this initial work with Maria, and then later has rolled into the work with Dr. whose last name I can't think. And so that's one example. And then the strategic plan, I guess, would be another example, because what I don't want to do is kind of have have somebody come in one time and we do a little work and we learn a little bit and we grow a little bit, and then that kind of goes away. I want something that's really built into the fabric of who we are, that has an ongoing nature, whether it's with consistency. So with certain providers that are consistently helping our staff to grow and develop, help us to develop our staff and develop the leadership skills of all of our staff, especially our BIPOC staff.
Great, thank you. Other questions from Board staff? Brian.
On your application, it says that the Blue Sky Bridge was awarded full accreditation by the National Children's Alliance, which ensures that the organization operates according to the best practices of CACs across the country. So my question is, do they actually conduct annual evaluations of your performance?
It's actually
or some periodic?
Yeah, it's every 5 years, and it is the most daunting process you can imagine. First, it lasts about 1.5 years, the whole process, and we do it every 5 years. So really, we're doing it constantly. We have 10 accreditation standards. Those standards are revised every 5 years. And so new standards just came out that will start in 2022. So we provide this, I don't know how many hundreds of pages of documentation every 5 years. And then 6 months later, we have a site visit where they come out. You keep moving around on my screen. Where they come out and do a site visit. This year was virtual. Well, it was last year, but yes. And they evaluate every single component of what we do. They meet with our multidisciplinary team members. They meet with staff members. They look under things. I actually had to carry my computer around so they could look at things and make sure it's a child-friendly facility and that it's safe. And they really dig into every single aspect of everything we do, or at least everything that they accredit. Like our education program is not accredited. It's not part of the National Children's Alliance work. That's outside of it. But everything else that we do, that they look at so meticulously. And many of my colleagues around the state of Colorado this year did not pass accreditation. So this is not an easy thing to accomplish. Some wonderful centers that do amazing work, but they did not pass accreditation. So they have to go through another process to sort of prove themselves over the next years. It's quite a process.
Thank you.
Karen Roney.
Thank you, Caitlin. So just to clarify, back in your previous responses about your 3-year DEI plan. So did you say you have that completed or you are in the process of completing it?
I just signed the contract
To work
start
on it.
the process. Yes.
Okay.
Up till now, we've done a lot of piecemeal work. I mean, if you
Got it.
look, I have a lot of things I could point to that we've done over the years, but I really wanted to put something that's more fundamental to who we are in place.
Yep. Got it.
Piecemeal. Mhm.
So then how do you imagine that will be integrated in your agency strategic goals? And what are those agency strategic goals for the near future?
Yeah, so we're in year 3 of our strategic plan. So we'll also be doing our overall organizational strategic plan that we'll be working on that next summer. So our strategic, so DEI goals are already in our organizational values and are already embedded in our strategic goals as an organization. Not as in neither case are they like called out at the top line, but they're embedded throughout the descriptions of our values and our strategic goals. And I'd be happy to send those to you. Sorry, I don't have them off the top of my tongue. I'm afraid if I take 5 minutes to dig for them, I wouldn't find them.
You don't have 5 minutes.
I know, that's what I'm saying.
FYI.
Yeah, I know. So like our top line strategic goal was to put systems and a strategic goal for the last 3 years or the last 2 years was to put the systems and structures in place. We've grown so much as an organization, and it was time to put better systems and structures in place so that we can continue to thrive and continue to be what our community needs us to be. And part of that was this. So, you know, it was also like, how are we organized and what does our org chart look like and all of that stuff? But it's also, how are we ensuring that we are providing equitable services and that we are being good, good stewards of everything we do for all members of our community. So it was all in there. It's just, yeah. Does that answer your question?
That helps, because it seems like we've talked, you know, in past years about board diversity, and it hasn't moved, I don't believe. And then I saw you still have Mark Deaton is with the Longmont Police Department, which he is not.
I know. And actually the reason I didn't update it is that he's rolling off the board this month or next month. So I just didn't update it. But he, he just left the Longmont Police Department, as you know.
Yeah. Okay.
So I mean, I have invited, I cannot tell you how many people that represent different populations to join our board. Other members of our board have invited other people to join our board. As you can imagine, not everybody flocks to want to join the board of an organization that deals with child sexual abuse when you can join the board of the Humane Society. So it's a hard ask anyway, and I do think that's part of why we have struggled so much, but it's no excuse, and it will be an integral part of our DEI plan going forward. And I've said this every year, and I knew you were going to ask me, Karen. I knew it. I just knew it. But it's not for
I didn't disappoint you.
It is not for lack of trying. I assure you, it's on my EOS goals every single freaking week, and it's so hard. I know.
So we have about a minute left.
Okay. Do any other board members have questions to wrap us up, or should we give Gina a minute or so to wrap us up? All right, Gina, since I don't see hands flocking to the air, you've got about a minute to let us know anything that we didn't ask you about that you'd like us to know.
Yeah, and I know you read about all of this, but I think just keeping in mind that this has been a really terrifying time for the work that we do in particular. We are sort of kind of coming out of COVID. Kids are back in school, which is such a blessing. And more importantly, we are back in schools. Not more importantly, it's most important the kids are there, but also we are back in schools, and we are, our caseload is on the upswing, which is very promising. We know that kids have been stuck at home in a lot of cases in very unsafe, scary situations. We have seen horrific cases over the last 2 years, a lot more human trafficking, a lot more witness to domestic violence, a lot more severe physical abuse, stuff we're not accustomed to seeing as much of, and less of sort of the regular child sexual abuse by somebody in the home, which we know is still happening. So just, this is a time for us all to just be thinking about these kids and doing everything we can to keep them safe. So we work really hard at that every single day.
Thank you so much, Gina, and thanks for your time this morning. We appreciate it.
Of course, thanks you guys for doing this on a Saturday too. Bye, guys.
Bye. Hello. So do you want to go ahead and turn on your video?
I'm so sorry about that. I thought I had hit the button to start my video.
That's all right. It's quite fine. And so are you Melinda?
No, my name is Kelly Cuevas, and I'm in the Boulder office.
Okay.
Who writes the grants and the grant reports.
Okay, great.
It's from our Denver office, and she's our grants manager, and so she oversees the work that I do.
Okay.
And
I just was checking to see who we had. So all right, so we will go ahead and get started. We have 15 minutes for that's really it's a Q&A format, and so I'm sure that you'll answer all the questions that we throw your way, and I'm going to go ahead and keep the time on that. And Caitlin Abbott is the chair of our Housing and Human Services Advisory Board this year, and she will facilitate the Q&A session. And so if you are ready, we are ready.
I'm ready.
All right.
Hi, good morning, and thank you so much for being here. To get us started, I will just open it up to the board and staff to see questions. Graham.
Thanks, Caitlin. Good morning. I'm looking at your outreach and engagement section, and you say that y'all are focused on reaching underserved populations. Can you talk about what exactly you're doing to focus on that?
Sure. So we partner with other agencies in the community that also work with low income, low resource, low SES status, and try to create a referral system from those relationships. Outside of our regular adverts and, however our presence may be on, the social media or the internet, what have you. So we feel, since we only serve residents of Boulder County or people who have legal issues in Boulder County, it makes sense to us to partner with those agencies who serve the low-income population in Boulder County.
Got it. Thank you.
I wonder if you could talk a little bit about how how the services, if they have changed during COVID in terms of the types of cases or the services you've been able to offer.
Yeah, so much has changed. The types of cases we've been seeing, that has changed a lot. Family law usually isn't so prevalent in our caseload. There's usually like a split. Percentage wise, it's fairly predictable, and our family law cases have been exploding. And not only that, the complexity of the cases has increased, and the instances of domestic violence have gotten more severe overall. Not every case, obviously. It has been harder for us to place cases with pro bono and contract attorneys. Attorneys themselves are essentially small businesses, most of them that aren't part of large firms. And so everyone got real concerned about their bottom lines at the onset of the pandemic. And everyone, tightened up their belts a little bit, and we haven't seen any letdown of that. And we've only been able to place with pro bono attorneys about half of what we usually do this past year. So it's been a challenge. We've been trying to get creative with our service deliverables. Because of that, we've made some improvements to our Pro Se Clinic to make that more accessible to people. The Pro Se Clinic is a do-it-yourself family law program where people can get advice on how to fill out their pleadings and their forms and what their next steps are, how their case moves through the judicial system, etc. And it's an empowering program, but it's really meant for cases that are like low conflict, low asset, parties agree on a lot of stuff, no violence. And because of how few cases we've been able to place with adequate floor representation, the Pro Se clinic has kind of become a catch-all for some of those cases that just don't get placed the way they should. And so we're at least doing our best to make the improvements to that clinic so that it is as good as it can be for those cases. We also started a wills project. Initially, we wanted that to be in a clinic format where people would join on a day and meet to get their wills executed. But the scheduling on that was just a little outrageous. So we just are now calling it a wills project. And so ever since the onset of this wills clinic / project, we've been able to serve like 17 seniors with wills, and not just seniors, but anyone who is in a situation where they are vulnerable or compromised. Normally we reserve wills just for seniors, but in these pandemic times, it makes sense to protect those who need protecting. I do see Madeline Woodley has a hand. I don't know if it's my place to call.
Madeline, and then we'll do
Yeah. Yes. Good morning. I wanted to know, you answered and said that you team with agencies that would help facilitate the diversity efforts. Could you be a little more specific and let us know who some of those agencies are?
Yeah, so absolutely. SPAN and Safe Shelter. And I'm sorry, I just hear an echo that confuses me a little bit. SPAN, Safe Shelter, EFA is a real big one. And then we also partner with some more rural areas, like out in Netherland and Allens Park. I mean, rural is in loose air quotes. But so we'll get in touch with agencies there, senior centers, age well centers, and we have what's called a warm referral system, where if an advocate or staff member at an agency feels, that perhaps someone might be able to benefit from our services with that person's permission, they will then send us an email that says, hey, this person might need X, Y, and Z. Can you reach out to them? And so then we take the initiative, and then we reach out to that client to get them screened for eligibility to see what we can do for them. And if it turns out that we can't help them, or for whatever reason they might not be eligible, then we have referrals to other law offices or agencies that are doing whatever work that they might need. So did that quite answer?
Yes. I was just, I'm wondering if you are familiar with the NAACP and the Boulder County branch that is now very, very active in Boulder. And if not, perhaps you may want to add that organization to your list.
Yeah, I absolutely will.
Very well, thank you.
Thanks, Madeline. Karen Roney.
Thank you, Caitlin. So where's my question? So I guess a couple of things. One is that, the Boulder office has had the same staffing level for a long time. I've been around a long time. I think that's been the staffing level for a long time. What's on the horizon? What's the possibility of really being able to enhance staffing for the Boulder office? So, I mean, I know most of the money comes in from, the Legal Services Corporation. There are some small, grants that you get locally, but it's been the same for a long time. So what's on the horizon for more money coming into the Colorado Legal Services Corporation?
I have never felt so seen and heard. Like, just thank you for acknowledging that has been our staffing level forever. We actually are, we're trying very hard right now. We actually got one of our law students got a Gologly Fellowship, which is incredibly prestigious. And so he's going to be with us. They're paying his salary. We're paying his benefits. But so they're paying his salary for 2 years. And in that time, he started in August. He just barely passed the bar and got sworn in like a week ago. So it's still very new, but he was with us for 2 interns or 2 semesters as an intern. So he's very familiar with our mission, our values, our case protocols, our database, our everything. It's such a smooth transition to have him, and he's focusing his time on COVID recovery work, housing, consumer issues, bankruptcy, fair debt collection, etc. And we have decided as an office that we will just make the appeal to the Denver office that we absolutely must somehow obtain funding to fund his position permanently, because there's no way we can benefit from having a second attorney in the office for 2 whole years to go back to a 1 attorney office, especially when our services are needed more than ever, and most of the work that gets done by the in-house attorneys, since pro bono cases have been so hard to place lately. So we have a mission. We just don't quite know how we're going to execute it at this time, but we are working very hard at obtaining funding.
So this is probably a stupid question, but I mean, does the federal government, do they provide increased services, increased funding for legal services? Do you get like an annual increase? Do you ever get an increase from the feds, I guess?
Yeah, so Congress actually decides whether or not they're going to increase or deny the budget. And so it's maintained. It hasn't necessarily increased, if you will, based off of like inflation and what have you. It's about stayed the same. So we're hopeful that it will increase, but more than anything, I think we're just hopeful that it will maintain.
Right. Okay.
These times.
And then my second question is, there was a reference in the application to the agency's role in system advocacy. So can you talk a little bit about what that means, or what does that look like, or what advocacy is Boulder County Legal Services doing for what kind of systems?
Sure. So one of the most important things that we do with every client, they all get an appointment with the attorney. Usually those are in person, but lately they've been over the phone or Zoom. But they basically get to explain all the details of their situation, and the attorney will explain their case to them thoroughly, explain what possibilities they have, what their rights are, what their case will look like as it moves through the system, and if it's a situation where they have to represent themselves in a way, they'll get taught how to do that. Like, this is how you get a motion, this is where you take it, this is what you have to pay to file, this is how you serve someone. And so everything is meant to be as empowering as possible. The legal system is very confusing, and it's intimidating, and it's very scary. And so we try to take the fear out of it.
It's really about how to navigate through the legal system.
Yeah.
Okay.
And
all right.
It's not that scary when you know what's happening, and when you know what certain types of hearings mean, and what things are going to happen and what to expect. And so we try to really just take the mystery out of it and give people plain language, flow charts. We're redesigning some of our literature to make it easier to understand, easier to read, taking out information that's like nice to have but not necessary. And that's just for readability purposes, because we've learned through some other agencies that increases efficacy, and it just makes people feel better about understanding and digesting the material. So we're also in the process of doing that. And then we work closely with the courts and the family court facilitators. And, you know, we'll email a family court facilitator and say, hey, I've got this person and I want you to keep an eye out for them. And you know, like making sure that they're getting what they need from the people that they need it from in the court system.
Thank you.
Deanna.
I'm just curious if you've noticed with courts being virtual, if your clients are having difficulty accessing court services, some of them, or maybe it's being balanced by the fact that some people have an easier time using their phones or whatever to get to court instead of actually attending. But if you've noticed sort of a digital gap, and if you've taken any steps to assist clients with that process, if they don't have access to the tools necessary to access court now.
Yeah, of course. So we actually got, for security purposes, none of our computers at work have cameras on them. And so in response to the pandemic, we actually got a computer with a built-in camera so that people could come to our office to attend their WebEx hearings.
The voice with the built-in promises sections are
sorry,
stand
computer.
Still. No compromise.
Stop.
The voice with the built-in promises sections are stand still. No compromise. Burn, begin, and frame up.
Okay, I'm sorry about that. So we did that for our clients who could, if they didn't have reliable internet, or if they didn't have a camera, or you know, with some people don't have an adequate computer, but they just go to the library for their computer needs. But we don't really want people on WebEx at a court hearing at the library, you know, so we definitely invite anybody who needs it to come to our office for their hearings. It doesn't happen very often, surprisingly. Most people are pretty set. But we thought we'd be utilizing that system a whole lot more than we do, but it's absolutely available. Absolutely. And we have seen that people are more likely to attend their hearings and to show up on time in the virtual model. So it's actually real great. It's great for a lot of our clients. It's not a perfect system, but we like it.
Thank you.
So Caitlin, that the buzzer did go off for 15 minutes. So I don't know if there are any last minute questions or if we are closing it down.
Looks like we are complete. Thank you so much for your time this morning. We appreciate it.
Thank you. Thank you for having me. Have a nice weekend.
You too.
Bye.
So I think I'll go ahead and let Donna in. Good morning, Donna.
Morning, Karen. Hold on. We're trying to get this so that we all can see it.
Are you all together?
Yeah, Betsy
Okay.
was supposed to be here, but yeah, I came into the office so that we could.
Okay. Well, we're just like a minute early, so I didn't know whether you wanted us to wait.
Can you see us?
If you
Yeah, you can.
expected-
Riley, if I put your chair. I'll scoot back a little bit.
Hi, Edwina.
Good morning, Karen. How are you?
I'm fine. How are you?
I'm good.
Donna, you coming back on the screen?
Oh, yeah. Yeah. I'm just going to scoot over this way.
Yeah, you
That's
need to
not so
scoot.
bad.
You need to scoot. Okay.
You
So,
scoot. Come on, Riley.
Riley's on her way here, just across the room.
She'll went by there. Oh,
right. So we have 15 minutes for Q&A. The board is ready with their questions and you all will provide answers. And then if we have any time, you know, toward the end of the 15 minutes, we certainly will turn that over to you to make any comments that you think we need to know before we close out. So So I'm the timekeeper. Caitlin Abbott is the chair of our advisory board this year, and she's going to be facilitating the Q&A session. And I think we are ready. So take it away, Caitlin.
Hi, good morning. Thank you so much for being here. Is there anyone on the board who has a question to get us started? Brian.
Thank you, Caitlin. Good morning. I was noticing, and I think this has probably been true, I don't know if always, but for a while, there's no federal or state funding sources, and it feels like today's climate, there's a lot of programs that may potentially be a good fit for your mission. Do you have anybody who can pursue those, or thoughts on that as potential funding?
Yes, and in fact, this year we hired Riley, who is our grant writer, and she's on a learning curve, but absolutely we need to. And we also talked to our auditor because we need to file the, I think it's called Brad and Dunn's, which is something like that. Yeah, something Dun and Brad.
Dun and Bradstreet.
Thank you. Yeah.
Yep.
So we need to file that in order to be able. So our auditor has said yes, she will file that form for us. So hopefully, yes, we will be able to start doing that.
Great. Thank you.
And Donna, I'm sorry, we didn't invite you to introduce the three people that are in the room with you. So maybe if you want to do that quickly, sorry.
Thanks, Karen. Sorry.
I'm Edwina Salazar, and I've been on the board since the fall of last year. So it's coming up on a year. And I'm really enjoying my time here. It's great to see Comite and what they've done during COVID and the plans for the future.
Right.
Hi, I'm Riley Nelson. I've been the grant writer for most of 2021, and I'm transitioning into development coordinator.
Yeah. Okay, great. And then we have Donna Lovato.
And me, Donna
Okay.
Lovato. I'm the executive director.
Yeah.
Sorry, guys.
Great, thank you all. Other questions from the board or staff? Karen Phillips.
Hi, good morning. I just was curious on that N400. Does that mean they're guaranteed citizenship, or what does that mean?
What the N400 is, the application for them to apply for citizenship. So what it means is they already have to have their permanent residency for at least 5 years. And then there's different rules. If they've had it for 15 years, they can take the test in their foreign language. If they've had it, if they're a certain age and they've had it for 20 years, they get to answer in their language, and it's only 20 questions. And applying for the N400 does not guarantee them, but we have attorneys that review. So we fill out the applications with the client, then they see an attorney who reviews it. And pretty much, I don't think the biggest I think we've got is that they need more information on that N400. I think one got denied, and all the times I've been doing them because he hadn't made payment arrangements with the IRS. But basically they said once he did that, they would give him back, he would be back in the the application process again.
So if they pass, then they get citizenship?
Yes, they have to pass so that's why we do the citizenship classes and the ESL classes, because not only do they have to pass the test, so it's not just about memorizing those 100 questions, because what happens is you have to learn the 100, but they only ask you 10. As soon as you pass 6 of the 10, you're passed, but then they'll ask you to read something, or they'll ask you a question and you have to answer it back. And it could be something as simple as, what's the name of the street you live on and what color is your house? And then they have to answer in a complete sentence so that they know that they understand English and they can speak English.
Oh, wow, thanks.
Yeah, that's a pretty tough test.
That's tough.
Brian.
Thank you. I had a question on the evaluation. In the application, it says that the measurement tool we will use is a survey that will be conducted at a predetermined point. in time to a selected number of clients. So is this a new process or new tool? And if not, then what is typically the schedule for that predetermined time? And
they did it before I became the ED. And so I kind of used some of their same questions and then some of the ones that I decided. And it's a very simple questionnaire. In fact, we're doing it right now. So we run it for like a quarter of the year. We didn't do anything last year because of COVID. And so when people come in and they usually give a donation or they need to set up another appointment, the admin assistant will give them, it's a kind of a yes, no, 1 to 5 questionnaire. And they drop it into a box and then we take them out and nobody sees them. And then I put them all together and everything goes in there, the good, the bad, and the ugly. So yeah. But
so you do that quarterly, 4 times a year?
No, we just do it once a year, quarterly.
Once a year. Okay.
Once a year.
Thank you.
Yeah. And so, yeah.
Great. Thanks, Donna.
Yeah, thank you.
Karen. Roni, sorry.
So there was a comment in your application that I was interested in just understanding it a little more. So there were, to the effect that the executive director set up a meeting with community members about who should be contacted if an issue arises within the Latino community. So can you talk a little bit about the reason for that meeting and what does that mean?
Well, I think part of it was, I'm sure you all remember, there was an incident at Garden Acres Park where 2 men were got in a fist fight. And then it turned, the person did not contact El Comité. They contacted somebody in Denver who contacted a community member who contacted my board member who then contacted me. And bottom line was everybody had a different story and nobody ever really talked to the guy. And it was just decided that if an issue comes up, El Comité should be the first one contacted. We're the ones with all the resources. And it was just, everybody had their hands in the pot and people were going to see city council or the city manager, and the DA's office ended up calling it basically road rage. And there was a lot of misinformation that was given around. And I think if we're going to be helping our Latino community, we need to know the story, all of us, the same story. And that's why we decided it was El Comité. So if something like that ever arises.
So Donna, you're saying that the folks, the community representatives in this meeting decided
yes,
that El Comité should be the hub or of the information.
So we had representatives from the community. We had CERC here. We had somebody representing the Latino community. And so we just all got together and talked about if this happens again. And, you know, they didn't even realize what El Comité had done. The minute we found out that had happened, we reached out to the person. We were able to get them connected to some different places, but they didn't know that we had done that. And I didn't know they were doing stuff on the side. And so that's kind of where it came up from, because it just doesn't make sense that everybody works in their own circle. So that's where it came from.
All right, thank you.
Other question, Karen, I see you have another one. Please.
I have another.
That's
yeah,
right.
I have another. So can you talk a little bit about your financial situation? So in looking at the audits or your reviewed financial statements, is at least in 2018 and 2019, I don't think we saw a reviewed financial statement for 2020, but you certainly have been in a deficit spending scenario. And then I also noticed in one of the financial statements that like in 2019, there was only like $2,500 listed from the City of Longmont, and your grant was more than that. So anyhow, I guess my general question is, what's the state of your finances going forward?
Getting better every day. I think in 2019, they were not looking so great. I think, and I talked about this a little bit last year, so I'll talk really fast. I was the interim executive director for almost 2 years, I think, and funders were not giving money to agencies with, and so the board, I don't know that they didn't realize that, but then they did make me the executive director. So we did have to play catch up. We, as an agency, I think last year, right before COVID, we actually laid off some people and took some people less hours. And COVID was a curse and a blessing at the same time. I was able to have a lot of quiet time. I wrote lots and lots of grants. And now we're actually not in the negative anymore. And as we speak, our audit, our financial review is what they call it, is complete. She will be at the board meeting this Wednesday, the 27th, I think, to present it to the board. And so then we will have it and we can send it. It's amazing from that to this. And because of all the grant money we've really been able to do a lot more stuff here at El Comité. We've increased our staff. We've done a lot more work within the community. We've been able to give grants to people who may not get the money from otherwise the No Worker Left Behind fund. And we got grants to help people with rent who wouldn't qualify otherwise. So yeah, but yeah,
it'd be great if you could send that on when it's after the board is
on Thursday
accepted it. That's fine. Thank you.
One question I had was, you've noted that you've got right about 38,000 in reserves, and that the board, the financial policy is 3 months of normal operating expenses. Is that 38,000? Is that 3 months of operating expenses, or how much is that in terms of your operating expenses?
Well, I think you'll see when you get the new financial report that will be approved by the board on Wednesday, is that we now have the reserves in place. And I think you're correct. It wasn't meeting the financial policy, but now certainly you'll see that we now meet our own financial policy.
Okay. And the other thing, Caitlin, is that we did have to take money out of there when times got really slim during like 19 and 20. So yeah.
Okay. Thank you. Other questions from the board? All right.
I do have a question. If
Please
no one
go
else has a question. I have to look at my question. Sorry. So like, I guess the general question is what, you've done some things differently in the virtual environment that we've all been living in the past year or so. So like your workshops, your document, your I can't remember, but the name of your workshops,
the learning sessions.
Thank you. Well, lots of learning sessions, but the ones you do for people that are signing up to become your citizenship workshops. So you are doing those. You started to do those virtually, and some other things. So I guess I'm just wondering, what are you going to continue to do in a virtual format moving forward, because you found that to be effective, and what might you be going back to the way you did business before? So it was really the citizenship workshops that I wondered about, because those were pretty big productions.
Yeah.
And so I'm just wondering what the future of those.
Well, so what happened is CERC came in and trained staff on how to do those applications. And then our attorney came in and did another kind of round of training. And so now everything is done one-on-one. So we basically do them 365 days out of the year if we need to. So we don't have a specific every third quarter. Right. And so, and we don't need to get volunteers. And so my staff fills out the application, and then the attorneys come in. We have 3 different immigration attorneys that come in almost once a week, each one. And they will take a stack of those applications, The client will come in, they'll review them with the client, and then they get mailed out. And so it's really nice because we don't have to say, well, we're not doing it until March. If they come in, we give them a list of everything that they need, which is kind of what we were doing before, that they have to bring in with them. So that's the information we used on the application. So things, your address for the last 5 years, or all your children and where they live and things of that nature. So it's not something that they can just, so we still do that part. And we're able to do as many as we get. And the other piece of it too, I think, is we've seen a decrease in people applying for their N400s, but an increase in people applying for their I-90s, which is the renewal of their green cards, which is interesting. I don't know why. We're still working with the bank. We've sent people there to see about a loan if they can't afford it. So, I don't know if it's a money issue or people are worried that if they lose their green card, because they say, I understand I'll have to pay double, but I want to be sure that my green card is set before I, if something happens and I don't get my permanent residency or my citizenship.
But as far as like digital services, we haven't really done much of that. We're trying to do things in person because our clients have limited access to technology or limited knowledge of using the technology. So they come in for Zoom meetings for other agencies to us so they can have those meetings that they need to attend.
Okay. So the buzzer went off, so signaling our 15 minutes. So I don't know if there's any questions.
You guys see this? Just real quick, not questions, but we did the book back like 20 years ago. They did a book, We Too Came to Stay. This is the revised edition, We Too Came to Stay. And they're actually in print. We should have them by the 1st of November. We're gonna hopefully have a launch. We're working with different people in the community. So it's going to be part of our fundraiser this year because we were not able to have a fundraiser, but we are planning our fundraiser. And we did apply for worthy cause grants. So if anybody does anything with a higher power, think of us. And we did find a building. It's up north, kind of behind Ace Hardware, kind of in that area. And it would fit us perfectly. And so we've got our fingers crossed. And once we will find out worthy cause in the beginning of December or December sometime. And then Riley's been researching grants that do capital. And so we're hoping we can do that. So.
You're leaving our lovely building?
We love this building, I know. And it looks really cool. You're gonna have to come see it before you leave. It is so tight. We're on top of each other. Riley's desk is in here with my desk.
I understand. Okay.
But I did paint my office, so it looks nice. Anything else you guys want to add?
Thank you all for being here. We appreciate your time on a Saturday morning.
Thank you. Thanks. Bye.
All right. Bye.
Bye, guys.
Bye.
I need to step away for 1 minute. My husband stepped out with one of the kids and the other kid is, I don't know what's going on.
Okay.
So I will be back in like 1 minute.
All right. So Shakita, are you done with the council forums or do you have any more still to go?
I am done. Hallelujah. Thursday was the last one.
Was the last one?
Yes. Yes. So much work.
Wait until you start getting those council packets.
I know. Yay.
Just need to find a volunteer to read them to you while you sleep. I hope that You get osmosis.
Have it go in your brain. Yeah.
That's why we're gonna have interns.
All
right, sorry about that.
right. There we go. Our focus reentry just came in the building, so I will admit them. Good morning.
Good morning. How are you all?
Good. How are you?
I'm good, thanks.
So, so we have 15 minutes to ask you questions. You will provide the answers. I will be your timer, and Caitlin Abbott is our chair this year of the Housing and Human Services Advisory Board. She will facilitate the Q&A session. And maybe to kick this off, if you would love to introduce yourself to the rest of the board. You can see our names here, but why don't you let us know who you are and your role with the agency?
Yes. Yeah, I apologize. I had a little bit of a technical glitch on this end, so I didn't get my name changed yet.
It's fine.
I am Molly Bowers. I am the Executive Director of Focus Reentry.
Great.
All right, great.
Welcome, Molly. Thank you so much for being here this morning. We'll start just by opening it up to questions from board and staff.
Okay.
Graham.
Thanks, Caitlin. Good morning, Molly. So last year, I think you were asking for funding for phones. It looks like you're not doing that anymore, but more interested in housing. I guess I'm interested in hearing generally about that, but then specifically in your budget, it looks like you're asking money for what you call direct client cost. What is that?
So for the housing program with direct client costs, that could be anything from helping them get IDs. So they may need help paying for an ID so that they can have their documents ready to get housing. That can also be things like a lot of our clients need dishes and they need stuff when they move into their house. So that's where we allocate those costs.
Okay, thank you.
Other questions? Karen Phillips.
Yes, good morning. I just wonder, how do you find housing?
It's not easy. So first of all, we do it two ways. You know, as I said in the application, we prioritize through the VI SPDAT, and then we also act like mad people when the lotteries come out, the HCV lotteries. So Boulder Housing Partners, Longmont Housing Partners, we enroll as many clients as we can in those lotteries. And when we get the vouchers, or when we do have a client that moves up through the one home system and gets permanent supportive housing, we have to move on to the next step. And that is advocacy on their behalf. So we almost always have to address criminal background, what's gone on. If it's Boulder and Longmont Housing Partners, they look about 3 years back. Other organizations can look as far as 5 years back. So we start with that piece. When we submit the housing packet, we submit an explanation of background, what's changed, how this person plans on going forward. We oftentimes attend informal hearings on their behalf to help them advocate for themselves. Then if they have a voucher, that process typically goes on again with the landlord. So we have to identify the landlords that take the vouchers and then again, speak with the individual. If it is somebody who has permanent supportive housing, say through Boulder Housing Partners, we usually do have another informal hearing, but they're a little more flexible and we don't need to find the landlord. We already know who the landlord is.
And are you able to give housing to everybody that needs it?
Not everybody. There are some that people won't take them, but we've been pretty successful. So it's not everybody, but I would say this year alone, since 2019, we've gotten 75 people in. And this year alone, I think we're looking at about a 40% rate.
So Molly, I would not assume that all of our advisory board members knows what the heck a VI SPDAT is.
Okay.
And some of the other processes that you're kind of throwing out there in terms of housing. So, anyhow, like one home. So I have a question, and then maybe you can go back and clarify some of that. So
absolutely.
You mentioned that focused reentry is a continuum of care through Metro Denver Homeless Initiative.
Yes.
I basically thought that MDHI really is the only COC for the Metro Denver region. So can you clarify what you mean by that?
Yeah, I think I wrote that in a confusing way in my application. So they are the CFC. We are partnerships under their CFC. So that circles.
You can access the the referral system.
Yes.
Right. And the coordination and the continuum of care for the advisory board is really the federal dollars that come in to support housing comes in through the Metro Denver Homeless Initiative, which is basically a 7-county region, Metro Denver region. So
correct. Yeah, and so that circles back to what I was saying with the VI SPDATs and the coordinated entry. In our partnership with them as a member of MDIH, we run, so a VI SPDAT is a system that is a HUD system that prioritizes people for housing based on a vulnerability scale. So they take a look at who is homeless and what makes them vulnerable. And the unfortunate part, I would say, is it's quantitative in the sense that somebody is given a score, and the more vulnerable you are, the more likely you are to be prioritized for housing through this system. And then one home, which is the coordinated entry point, so that also comes through MDIH, is who prioritizes people, right? So they all reach the top of the list, or not all, but people reach the top of the list. And then we sit down at a case conferencing with one home and we say, hey, this person, we have all of their documents ready for housing and we think we can move more quickly. And unfortunately, this person, nobody's heard from in 6 months. So we don't know where they are. And so at those meetings, then we make the kind of final decision, who gets prioritized for the voucher. We also, through MDHI as a member, there have access to funds. For example, we had a client who was approved for housing, but he had a past eviction on his record and the landlord had a judgment against him. And through MDHI, we were able to get funds to pay off that judgment and to get that lifted. And he was able to move into housing once that was removed. And that comes through them and their HUD dollars, and we apply through them. Then the other process that I also threw out acronyms was the housing lottery that goes on in both Boulder and Longmont. So Boulder Housing Partners does it and Longmont Housing Partners does it. And people who are low income or experiencing homelessness, it's a lottery system, just like we're all familiar with, and you fill out an application and you put your name in and they draw a certain number of vouchers for housing.
Thank you for those explanations. Karen Phillips.
Yeah, how long do they get assistance? And then do you try to help them get a job and sustain their place and all that kind of thing?
Absolutely, yes. So getting them into housing is really the first step. Then we continue to provide case management for them. Lonnie, my program director, she is the primary point of contact for the case management. So that involves stopping by where they live at least once a week, sometimes more, and then assisting with finding employment, securing some of our clients are actually on the older end of the spectrum, so they have Social Security. We also help them do things that I think a lot of us it's common knowledge too. So I helped one of our clients hook her debit card up so she could have her rent withdrawn off of her debit card. So the case management involves those things. We have some clients that I would imagine we will case manage potentially for years. We have others that they get out. Once we help them secure employment, they get on their feet, they get a job, they don't need us as much, and it sort of wanes off into just, you know, a phone call once a month, how you doing, that kind of thing.
Karen Roney.
Thank you. You know, this application didn't really talk a lot about the role of volunteers. That really has been, as I recall, a particular kind of cornerstone of the focused reentry services. And we don't really hear about volunteers at all. It sounds like it's mostly staff that's doing the work. So can you just speak to that?
Yep, absolutely. So the volunteers are still here. You know, we started as a mentoring program with community mentors, you know, that volunteered from the community, and we will always keep that program. And so in situations where a client has a mentor, the mentor is heavily involved in this process. They will come to the informal hearings if there is one. They will definitely meet the person out in the community once they are housed or while they're in that process. I do have a hard rule is for the program, I don't allow volunteers to go to people's houses. So we still don't do that, but they meet them out in the community as community support. Then we've also, with relations to the housing program, had kind of a fun way to bring in our volunteers. We have a guy that fixes bikes for the clients so they can get around and get to their jobs, because a lot of them don't have cars. And we had another guy help a client fix his door lock as well. And then we have a woman who loves to just help everybody search for jobs. She's employed through Salesforce, and so she helps a lot of them with employment searches, even if it's not directly their mentee.
Apologies. Molly, I'd love to hear, so a lot of what you're talking about really is focused on the housing piece of it, because it sounds like what you've identified is that the housing is a huge component around the recidivism. Could you share a little bit about, you know, sort of what you see in terms of your clients who you're not able to place for housing, what the recidivism rate is versus those that you are able to get into housing?
It's significant depending on the person. So clients who we have that are experiencing homelessness and absolutely cannot get housing, usually that's a result of, unfortunately, their background is too intense for people. They will go in and out of the system. So the recidivism rate there, we are running with Dr. Ward. We're going to run a specific control group. So it's kind of my unofficial numbers at this moment. But I have run it, and we're looking at those who cannot access housing, do not access housing. We're looking at about 72% within a year if they don't get housed. Now, to be clear, we're targeting those that we're trying to get into housing as well. So we are, you know, specifically looking at those that have been experiencing long-term homelessness at the moment. So.
Got it. And I wonder if, I'm thinking about like sort of the agency's strategic goals. Obviously, you started as a mentorship program and are really moving into providing some of the really specific services that are needed. Do you foresee, you know, you mentioned that there's obviously folks that can't access housing because of their criminal background. What do you see your agency's role in addressing that particular need and the impact on the community when those folks can't access housing?
So we've taken that on in two fronts. We continue to work with somebody as long as we can. So even if they can't access housing, we try and make sure they have the smartphone so they can call us. We still try and connect them with a job if they can get one, just something to keep them on their feet, though it's really challenging to find a job, obviously, if you don't have a place to live. We are also working with the shelter, Mike Block over at the shelter. They are looking at people that are particularly hard to house for various reasons, criminal background being one, and they are gonna potentially get a unit up for those people. So we're helping them identify certain members of the community where that would be beneficial both to the individual and in the best interest of the community.
And Caitlin, I think Deanna had a question.
Oh, yep. Go ahead, Deanna.
So I just had a question about the budget and your reserves specifically. So it looks like you have about 15,000 in reserves. And if my math is correct, that's less than a month of operating expenses. I don't know if that's like sort of your customary amount of reserves, or whether you've depleted those reserves, if you're comfortable with that level of reserves, or if you have a plan if those reserves are not sufficient.
Yeah, so I'll try and answer all of them. And no, it is not our customary amount. No, I am not comfortable with that level. We certainly would like to grow that. And that is actually from our standpoint, and I don't know how many of you on here are as familiar with us, but that's actually been built up quite a bit. We've run with a pretty shoestring budget for years. Little bit of background, I'll try and be quick because I know we don't have a ton of time. We started under the Colorado Nonprofit Development Center, so that was challenging to build reserves with them. We spun off in 2018 and became our own nonprofit, and that came with its own challenges getting on our feet. So we have built that up since 2018. The board's goal is to get us to 3 months operating expenses in our reserves, and we are working on that.
Thank you.
Mm-hmm.
So the timer just went off. So I don't know if there is one final question or whether we are complete, Caitlin.
It would look like we are complete. So thank you so much, Molly, for being here. We really appreciate your time this morning.
All right. Thank you, guys.
Bye.
Bye.
I almost pulled a Brian and hit leave when she said bye.
No, not yet.
You got to be disciplined.
Okay, Laurel's in the room. Do you want me to go ahead and let her in?
Let her in.
Let her in. It says that she's, oh, there we go. Good morning, Laurel.
Good morning.
How are you?
I'm good. How are you all?
We're good. So Laurel, we have 15 minutes for questions and answers. And Caitlin Abbott is the chair of our advisory board this year and for 2021. So she'll be facilitating this session. I will be the timekeeper. And if we finish up with our questions before our time ends, we will throw that over to you for any parting comments that you might want to make. So,
all right.
I think we're ready whenever you are, Caitlin.
All right. Hi, Laurel. Welcome. Thank you so much for being here this morning. We appreciate your time. Let's jump right in and see if anyone on board or staff has a question to start us off. Brian.
Thank you, Caitlin. Good morning, Laurel. Just kind of a real high level question. The immigrant and undocumented community has really been through a lot in the last few years. Are you seeing a change at all in the levels of fear or concern around them being in the community? Is that, I was hoping it's getting better, but I don't think immigration policies are necessarily getting better. So I was curious where you think they are.
I think things are tremendously better objectively after the new administration took over, but it always takes time for people to recover from 4 years of, of really targeted hate. I think the state laws have helped tremendously. It was a real show of support by the state of Colorado and particularly the communities in Boulder County to let immigrants know that they are welcome and that the years and years of discrimination are going to end. So we're hoping that does trickle down over the next 12 months.
And just to follow up on that, are you seeing that there's an increased willingness to participate in programs if it means somebody needs to divulge their identity, but they are undocumented?
We are finding people have always been willing to come in and talk to us. We find that people seem more willing, but COVID has kind of complicated things tremendously as far as finances, as part of as far as being able to participate in programs the way we would like to see civic participation. That's just kind of in a really difficult situation. But with regard to our services, people are aware that there are more opportunities on the federal level to access remedies, specifically because the Trump public charge rules have been eliminated. So people who just were not going to meet the ridiculously high barriers are now back to the old rules. So we are seeing more people being able to access green cards, which is wonderful.
Great, thank you.
Laurel, you mentioned that objectively things are getting better with the turnover in the administration. I wonder, I don't mean this to be a landmine question. I wonder if you could give a couple of specifics, because I think a lot of what we potentially see in the news is that the Biden administration is continuing some of the same, like the Stay in Mexico program, but that doesn't necessarily impact folks who are already here and in Colorado. And so I wonder if you could give us a couple of examples of things that you have seen change. I think you mentioned the public charge rule. Is there anything else where you're seeing a difference for folks in our community in particular?
That's a really great question. The timing is perfect because on October 12th, President Biden instructed the Department of Homeland Security to release a new memorandum, which I call Leave Our Community Members Alone. And so that is going to be happening. We're back to the Obama priority list of who might be apprehended. And it's basically no one who's in our community. So that's tremendously helpful. Then the additional part of that is, for, 20, 30 years, there's been this tension with regard to work site enforcement where, ICE might get a tip and go and raid a business. And then they come up with some easy deal for the business owners that are probably employing and exploiting people. And all of the onus has fallen on the shoulders of the immigrant. That all changed on October 12th to the Department of Homeland Security is going to assist exploited workers in filing complaints against their employers. So that's some of the objective information that we know and we're celebrating, and we're just now trying to get that information out to the community, because it might turn into something like a U victim visa or a T employment trafficking visa an individual comes forward, they have a commitment from the federal government that they're not going to get in trouble, and that all of a sudden it's going to be the exploiting employer that is on the hot seat with this administration. So I think that's great news for our community.
Karen Roney.
Thank you, Caitlin. So Laurel, I'm interested in the future of the Immigrant Legal Center. So you talked about it at some point in the near future. You're retiring, sounds like, or you're shifting your role to a consultant. The other two staff members who are not attorneys but are doing again a lot of the work, and that you're moving from what would have been a law office model to this community center model. So can you really explain that all to us, to me, to the board, about what will be different in the future from what we have known in the past?
Thank you. And I wonder, are you retiring at some point?
At some point, you bet. I've been around a long time too.
I'm looking at over the next 10 years. And so this organization is my third child. And I am committed to making sure that it is an institution that remains for the community. And so we've been working for a couple of years on this. We are in amazingly good shape because in the immigration practice of law, you don't have to have an attorney running the organization. So we're working on building up the number of OLAP, Department of Justice authorized representatives that we have, so that there's adequate in-house support. And then I'm going to slowly be transitioning. You know, at some point, the new executive director is going to be Belen Pargas Solis, who is a homeowner and school parent in Longmont. We're very excited about that. It is a lot of steps, so it's going to be a many-year process. She is spot on as far as the immigration cases go. We consult on every half-hour basis about what we're seeing. And frankly, at this point, her ideas are better than mine on how to approach cases. So we actually just began yesterday starting to explore more of the executive director roles, how our finances are structured. So as Maria becomes an OLAP representative to support Belen is going to have more time to, take on those other roles, some of the grant writing, working with the board of directors, finances. So I think we have a really good game plan in place, and it's my commitment to the community to make this happen.
So just a follow up, if I can. So it sounds like you have a 10-year plan. My plan is much earlier than that. But anyhow, so will there be a role for a licensed attorney moving forward?
That's up to the board. The problem with licensed attorney is, in order to afford a second licensed attorney in the office, I had to work 7 days a week. So my weekends were paying for there to be a second attorney in the office. I've been fortunate enough to be able to accept a lower salary than any starting law student or new attorney would take. So that's been, that's been our family commitment. And so we don't see a path to having an attorney here, but one is not needed. And that is sort of the magic that we can hand to the community when we eventually retire.
Got it. Thank you.
Other questions from board members?
I do have another question after Brian.
Okay, Brian, please go ahead.
All right, thank you. Laurel, do you provide any other services outside of the immigration law And if not, do you, outside of healthcare, like with Salud, where would you typically refer people who come in and are asking for other services? Business development or financial or anything like that?
So we rely on the services around Boulder County. We hand out flyers of partner organizations because we try to stick to the immigration law area. However, we're regularly getting calls from people that have concerns in other areas. Most recently there was a neighborhood disagreement, and a Latina family and a white family were going to court for corresponding restraining orders, and the Latina family had no one behind them. It was a mom and a 13-year-old son. And so Maria in our office, who is tremendously connected with the community, paired that family with El Paso, and someone from El Paso went as moral support for that woman. And I went and sat in the back just to kind of observe what was going on in this restraining order situation. So we try to fill in where we can, but we know it's really important we stay in our lane. We don't give people information that they really should be contacting a therapist for, or another professional.
Thank you.
Karen Roney.
So in reading your application, Laurel, there were a few references to what I would say some pretty significant advocacy and even lobbying work on the part of the agency. And so I'm just wondering what the boundary is, because when I'm reading that, I'm going, wow, that sounds like some pretty heavy duty political lobbying. And so, so I just wondered how you stay within those boundaries as a nonprofit that you are supposed to.
So obviously we don't do any, we don't get involved for any candidates. We're really aware of what those boundaries are for educating the public, educating legislators, and it's based on, hours of time that are invested in certain efforts, and we're way under. We're not anywhere near having to go for the C4 exception, because almost everything we do is actually education, and then a small part of advocacy or of lobbying if we're directly talking to our legislators. So we're good. And it was Terry Benjamin from EFA probably 25 years ago that did a program and had books on how to keep your nonprofit able to, participate, because, my favorite saying is, don't let your nonprofit be a nonprofit. We have to be out there saying Colorado has hateful laws. We need to change those. So we're very, very aware of what those limits are, and we're careful.
Okay, thank you.
Are there other questions? I think, Deanna, go ahead.
So I was looking over my notes this is my second year on the board. I was looking over notes from last year, and it looked like there had been some budget shortfalls for a few years. And it looks like from your application that that's not the case currently. And it looks like you paid down a mortgage, and I'm just double checking and wondering how you were able to sort of turn that around, I guess.
So I think I included in the application about our attempts in 2017 to expand our staff just within our budget. And that was too expensive for our organization, and it caused shortfalls for a number of years. We are now back on top of that. We actually just paid down another $10,000 on our mortgage, because part of my long-term goal is no mortgage when I finally retire. So we are now very carefully crafting a way to expand our staff. We are hoping to hear on Monday from the Rose Foundation that they're going to allow us the funds to hire the new entry level person. And, then we have the plan of how we're going to make sure that within that first year, we're able to get our income up to where it needs to be to sustain us, instead of just trying to jump in, pay a new salary on our own, and do training on the fly.
Thank you.
And I did just send Eliberto our audit. So our audit for fiscal year ending June 30th, 2021 was just finished, I think, last week. So
Okay.
A copy of that is in your hands.
Okay, great. And Caitlin, the buzzer did go off, so we can wrap up if there, and maybe there's another question.
I think we're good unless someone has a burning question that hasn't been answered. All right. Thank you so much, Laurel, for being here. We appreciate your time this morning.
Thank you very much. Bye-bye.
All right, you ready to have me? Bleh, you ready for me to let in our final agency? Okay. If I could talk. All right. Jacob.
Hi, everyone. How are you?
Good. Hey, Bill.
Hi.
So here we are. You're our final show for the whole season. So we have you've applied for 2 programs. So we have we will allocate 15 minutes per program. And Caitlin is the chair of our advisory board this year. She will tell us which one we're going to start with. It's really a Q&A session. So we're prepared to ask you questions. I'm sure you're prepared to answer those questions. And then if we have any remaining time, there will be an opportunity for you to tell us something maybe that we haven't asked and you're dying to tell us. So maybe start, Jacob, I think we know who you are, but we might not know who Bill is. So, but if both of you want to just introduce yourselves, and then Caitlin will take it away.
Sure. Hi, everyone. My name is Jacob Harmon. I'm the CEO of Boulder Voices for Children.
And I'm Bill Clift. I am the grants manager for Boulder Voices for Children.
Great. Thank you both for being here today. We appreciate your time. As Karen said, we've got 15 minutes for each program, and we have found that splitting it so that we can direct questions about one versus the other is helpful to make sure we don't give short shrift to either of the programs. With that in mind, we will start with the Strengthening Families program, and then at about the 15-minute mark, we will switch over to the CASA program. So do any members of the board or staff have questions about the Strengthening Families program to get us started? Brian.
Thank you, Caitlin. On the Strengthening Families program, I'm just wondering, can you give an update on how things are looking now that things have changed a little bit with COVID? We're hearing from a lot of different groups about isolation and the impacts that has had. Are you seeing that that's getting better, better able to serve your clients?
Yes, it's a little bit of a mixed bag in that, one of the challenges that has been with the Strengthening Families program since it was even with Children's First of the Rockies, before it came to Boulder Voices for Children, because if you'll remember, after they no longer could provide services, we took that program over for them. Is that one of just the fundamental challenges is that you have one parent, the visiting parent, who really wants to be there. That's the only time they get to see their child, right? And then you have usually a parent who doesn't really want to participate in the process, right? So, over the last year, we've had 122 cancellations, right? We do about 40 visits a week, and we've had 122 cancellations. Some of those have definitely been related to COVID. Some of them have not been, but we've been told that they're related to COVID, right? In order to get through our cancellation policies. And so, we've been providing in-person services since September 9th of last year. We've ramped up to 40 visits a week, which has been really good. And we've been able to reliably deliver services because of this extra safety and health precautions we've taken, and from the partnership that we've built with families. We have seen a steady increase, especially since the summer ended and kids are back in school, in requests for visitation. But we've never really seen a huge decrease as a result of COVID. When families haven't felt well, when somebody's been sick, they have partnered really well with us to move that visit to a time in which everybody's been healthy. And I'll tell you, to the first part of your question about isolation, the Strengthening Families program is critical for a lot of these kids to be able to interact with both parents in a situation in which they never would have been able to beforehand. So what we see is really good partnerships from parents around building sustainable parenting skills, so that each one of those visits is better and better, and that the relationships are growing and are nurtured during that time with us.
That's great. Thank you, Jacob.
Karen Phillips.
Hi, good morning. I just was wanting to know, people that graduate, do they usually get their children back?
So because almost all the cases that we're currently serving are domestic relations cases, whatever happens in custody court, we don't really sort of follow up on that. But by graduating, what it means is that both parents are able to spend unsupervised time with their kids, which is ultimately the goal and what we're really excited about. So even though custody may not even be shared after they graduate, it does mean that parents can see their kids without a court officer around.
So you probably fill the courts in with what the parents do?
Yes, so courts request notes, and then each parent can subpoena court notes and present for their case if they want. But what we found is that the courts are really, they like getting our notes, they like hearing about progress that is being made, and they're regularly checking in with parents about that and using it as a part of their decision-making process.
Okay, thank you.
Karen Roney.
Thank you. So Jacob, do you want to talk a little bit about, I mean, it sounds like that Voices has made a few changes in the Strengthening Families program since you took that over from Children First. Can you talk a little bit about what you're doing differently and how has that resulted? What were the results, I guess?
Sure. And it's a good question because fundamentally, what this program is and how the courts sort of still view this program, despite our best efforts, is they want just a safe place for parents to spend time with their kids, and there is some responsible person there who will intervene if there's a safety concern. That's really all the domestic relations court wants from us. But what we saw was that a lot of the families who were involved in this program would also either have a concurrent or a future dependency and neglect case, which is a child abuse or neglect case, especially around domestic violence. So what we saw is that this program was not only a great place to, a great opportunity for us to have families spend safe time together, but also a place to partner with parents who might be at risk of getting further involved in a legal system, partner with them to identify those places where they really sort of struggled as parents, and work with them to build healthy parenting skills. So what we did is we have a 15-minute check-in with parents, visiting parents. Those are the non-custodial parents who have the court order that they're not allowed to spend unsupervised time with their children. We talk to them about what their goals are, right? And their goals usually start with, I want to spend unsupervised time with my kids. And then we are able to have that conversation about what's preventing that. And then specifically give them feedback about ways that they can approach situations that are stressful, recognizing the triggers that they might have, where they might get angry and lose their temper, and work with them week after week, right? Cumulative effect to build those skills around identifying their triggers and gently sort of moving their responses to a way to address really specific concerns that have been brought up by the court. And we felt like that really restorative approach to this program was needed in the community, and that we could make work in terms of funding, right? Because there's so many cost savings that we were able to achieve because we're utilizing space that's otherwise available to our volunteers, right? And Children's First of the Rockies had to get their own space, right? So we can use space multiple ways, and that saves on operating costs. We really invested in getting an LCSW and an MSW to run that program and be able to offer that therapeutic component to build sustainable parenting skills. It's still something that we like fight with the courts about a little bit. They are really explicit that they just want us to be a person in the room taking court notes, right? But the fact is, we feel like that's a really big missed opportunity. And the courts say what it'll do is make one parent feel like you're on the other parent's side or whatever. And we just manage that as best that we can. But we felt like it was really important to have a restorative component to this program. And so far, we've made it work reasonably well. It is not a money-making program for us, right? And every little bit of funding allows us to continue that work. Because if we operated on just a monitored visitation model where we didn't do parent coaching or support, and we just were a sort of warm body in the room to intervene if something were dangerous, we could make this program a little more financially successful. But we believe that that would be just another missed opportunity in a system that frequently misses opportunities to intervene and help families really grow and heal together. So that's something that we remain committed to until we go bankrupt, which hopefully won't happen.
Jacob, I have two questions. The first is, you mentioned this sort of coaching and the feeling that a parent might have that you're on, a custodial parent might have that you're on sort of the non-custodial parent's side. I wonder if you could tell us a little bit about how, how this comes up sort of in the intake process of bringing families on board, if any commitments there are from custodial parents or around this. So that's my first question, is if you could talk a little bit about that.
Sure. Yeah, and we've recognized that the intake and the orientation process is really important and is ongoing, right? We do that initial intake where the dropping off parent, the custodial parent, they have a court order that they're required to participate, right? So even though they don't want to most of the time, and they sort of make scheduling a little challenging, Really, the beginning of that partnership is by being really clear about what we're here for, right? This is a really stressful time for families. They are not always thinking objectively about what this process is going to look like and what the benefit of it is. And so we've worked really hard from the beginning to orient parents that we are not on anyone's side and that we have a shared goal, which is safety of the child while they're here, but also while they're not here. And so talking a little bit about that process and really getting buy-in from custodial parents that the work that we're doing with the non-custodial parents is in the best interest of the child's safety, physical and emotional safety in the future has really helped. And we've gotten much better partnership with parents in the last couple of months since we sort of tried that approach. And we also recognize that it's ongoing. So we do that in our initial orientation process, and then we regularly check in and remind both custodial and non-custodial parents about why we're here and what we're doing and what that benefit is. Because no matter how many times we say it, these are emotional and challenging times for people and they may forget it. So we've just incorporated that into our regular check-ins with both visiting and dropping off parents.
Great, thank you so much. I wonder, so my second question is, you've noted in the application increased training in culturally responsive, and I think this was primarily mentioned in the case of ongoing training for CASAs, but I wonder if you could talk about what, if any, changes, with Strengthening Families. It's a fairly new program. What sorts of things are you looking at there to provide that kind of coaching, particularly for non-custodial parents in, a culturally sensitive and aware way? What requirements do you have of staff, and that sort of thing?
Yeah, that's a really good question. And this is, I can't believe I'm about to do it, but I'm going to quote Donald Rumsfeld. There are like known unknowns and then there are unknown unknowns, right? When we went into this, when we took this program, we knew that there was going to be a learning curve on a lot of this stuff. This was a population that we hadn't had a lot of experience dealing with before. But we knew a lot about what we had to train around, right? And specifically, there was a lot of cultural training just around sort of parent expectations, gender roles, sort of things like that in the various communities that exist here, Boulder County. But one of the things that we've had to learn sort of the hard way is that there's a lot of subtle cultural expressions. So one family for instance, comes to mind. We have a policy around bringing food. The visiting parent needs to get permission to bring food that we can run by the custodial parent, all of that, right? Well, for him, he was from a culture where, and I know this because my sister-in-law shares this cultural heritage, you don't go anywhere without bringing food for people, right? And we were banging our head against this wall. And so, they just weren't being compliant with our policies. Like they've read our policies, we've talked to them about these policies, right? And so identifying some of those places and then really going through the process of figuring out why we have these policies and where we might be able to make exceptions based on cultural expectations that we didn't consider when we developed a policy like that, right? So it's been a lot of learning. It's been identifying where have we not done such a good job and sort of created a problem where maybe there wasn't a problem to begin with. And that's ongoing work for us. Luckily, we have a really good and well-connected team who have resources, but we've also recently one of our former Strengthening Families directors has sort of come on and been in charge of our ongoing sort of cultural competency work, both for the CASA program and for the Strengthening Families program. So she's done a lot of training with staff and board and volunteers around cultural competency that's helped a lot and eliminated some unnecessary stressors from an already stressful situation.
So Caitlin, we have hit our 15-minute mark for this program.
All right.
I'm sorry, that's my fault. I talked too much.
No, I'm just the timekeeper.
You're totally fine. So we'll shift then to questions about the CASA program and the funding request for that program. So if there are any questions from the board or staff on this program, I'll give folks maybe a minute or so to make sure they've got the right, application pulled up. Brian. You're muted.
That's the first time that's ever happened. That's weird. I need you to remind me that there's no program, no fee for service revenue on this program. So when the courts, do they order or ask that there's representation for the children here?
Technically, it's an order. So what we, and we're in kind of uncharted territory with the CASA program in a lot of ways, right? There are 950 CASA programs, give or take, around the country. And we are one of a handful who are serving every child in the judicial district. So in January of 2018, I sat down with Magistrate McLean from the 20th Judicial District. I said, we want to grow. We eventually want to serve every child. And she said, well, how about I just appoint a CASA to every case? And if you have one, that's great. If you don't, we'll sort of do without it. And just by virtue of that, we were able to talk to our community members about it and recruit a lot more volunteers. So at our peak last year, we had 350 active CASA volunteers. We served 100% of eligible cases. There were a handful of cases that were a child was removed and placed in a really supportive kinship home. And we felt like we probably didn't need a CASA. That group was made, that decision was made by a group. So the magistrate orders a CASA to be appointed to every case as a matter of policy. And we do everything that we can to fulfill that order. But if we don't, we're not punished in any way, except to our pride.
But there's no real, but there's no, I mean, outside of the asks, the grants, the donations, there's no means to recover money through the judicial system for the services you provide.
Correct. That program is entirely reliant on community support.
Okay. Right. Just wanted to make sure. Thanks.
Deanna.
Hi, Jacob. We've spoken before. I did the site visit with, I think, Shakita for your agency previously. So I'm just wondering, in terms of the CASA volunteers, are you still doing virtual interactions with the kids that you're appointed because of COVID, or are you meeting with them in person? And if you're only doing virtual, I wonder if you've had any sort of measures of outcomes for that in terms of the kids connecting with the CASAs, since they're not able to see them in person.
Sure. So I don't want to get anybody in any trouble. When COVID first started, there was a lot of sort of, nobody really knew what to do. We just didn't have the information. And so caseworkers stopped seeing their kids in person. And what happened is our CASA volunteers saw that as an issue. And they saw their kids whether we asked them to or not, right? There were some CASA volunteers who, because of health reasons, et cetera, actually came off of cases because they couldn't be in person. Then the county attorney's office ordered us for a period of about 3 weeks not to see kids And so we complied with that court order. And then we pretty much went back to in-person. So there are some volunteers who continued to serve cases virtually because of either placements where the child was placed maybe too far away, or in a like a congregate care facility where the volunteer didn't really feel safe going and spending time. But the vast majority of our cases, I would say well over 90%, have been in person pretty much the entire time. And a lot of that, even when we were asking volunteers to be virtual, they sort of found ways to do it safely and see their kids in person. So we didn't gather any data one way or another about that.
Okay, thank you.
Other questions? Karen.
Thank you. So can you talk about your juvenile justice reform project? Is that new, or did I just miss the boat on that one?
No, it's relatively new as a formal effort. So essentially what happened was we have good relationships with the court, right? And the Chief Judge Bakke, who presides over juvenile delinquency court, she saw that a lot of the juveniles, a lot of the young adults who were coming into her courtroom had past experience or concurrent experience in the child welfare system. They had CASAs. They frequently had CASAs who were no longer appointed to a case, but were still in their life, who showed up to court to support that kid. So she asked us if we had available volunteers to be formally appointed to serve kids who had been charged with a crime, who had been also in concurrent involvement in dependency and neglect. And so we did that on a limited basis, and we're continuing to do that on a limited basis for cases that where kids, families, and professional teams identify as having a CASA be beneficial. So at our maximum, we only serve 10 cases. But we recently met with the juvenile delinquency team at the district attorney's office and the courts, and we sort of talked about how it had been going and whether we want to continue it. And what they essentially said is that the CASAs are really valuable mentors after cases close, right? So diversion is really committed to getting the kids the help and the support that they need during the life of diversion. But then after diversion ends, those kids will frequently fall off a cliff. So we're sort of transitioning that program from court involvement during a juvenile delinquency case to sort of post-case ongoing mentorship and support. So it's in flux, and we're really kind of trying to develop that program in partnership with our systems partners, really to make it the most impactful that it can. And what we heard is after a couple of years of doing this, because we've been doing it maybe 2.5 years, that where we could really make a difference is after case closure. So we're mapping that out and trying to do some meaningful program development and data evaluation of it.
All right, thank you.
Jacob, I'm looking at I was just looking at sort of the change in requests. One thing I noted is that it looks like you're requesting, you have fewer employees than we saw, for example, for last year, but more advocate supervisors. I wonder if you could talk a little bit about staff changes and how that impacts. Obviously, the CASA program is largely volunteer. And so I'm trying to sort of like understand what you've seen in terms of the number of volunteers and then how your staff, how the staff work within that context.
Really good question. And what we've really focused on with the CASA program is, because we have we're serving 100% of the kids, and there's not really a roadmap for what to do after that, right? Most CASA programs are just aspiring to that. We see our ongoing responsibility as strengthening and enhancing that work, right? Now that we're not just racing to get volunteers and train them and appoint them, we can really focus on what data are we gathering, where are we making impact, where are we not making impact that we might think we are, right? And really sort of questioning our organizing narrative as a program. And so what we've done is tried to increase the capacity of advocate supervisors who were once this sort of staff member who did a little bit of everything, right? So they had administrative tasks and responsibilities, they had external communications responsibilities, and they had volunteer management responsibilities. And so we've identified advocate supervisors as really the reason we hire them is for their skills in managing volunteers and helping volunteers navigate the complex systems that affect the kids that we support. So we've also then tried to sort of outsource some of those administrative tasks to another position that doesn't necessarily need such expertise in social work or therapy or child welfare, right? And also sort of strengthen that CASA program director position to be more systems focused, navigating systems relationships, representing the CASA program externally. So that shift is sort of underway, simply to be more efficient with everyone's resources and to enhance the capacity of the program to not just do more work, because we don't have more work to do, but to do that work better ongoing.
Got it. Other questions from the board or staff? Karen?
So I'm going to go off memory here. That's a little scary, but certainly, you know, in the past, CASA was holding a pretty large reserve, and then you purposefully spent that down and invested that in building and other kinds of things, new programs and bringing staff on. And so it seemed like when I read your proposal, when we talked about reserves, it's like, well, you know what, we shouldn't be amassing a lot of reserves. We should be spending that money on the services and the community that we're here to serve. So can you help me kind of understand? I mean, that's a big shift, which is totally fine, and I get that. But I'm just wondering if maybe you can help to clarify that. It sounds like we should have reserves for capital repair and replacements, because now we have ownership of the buildings, but we really shouldn't be doing an operating reserve. So can you just clarify that?
Yeah, actually, somebody just approached me about an endowment, and we sort of had a similar conversation about how, you know, the resources that we want to deploy immediately for immediate effect. So when I started 4 years ago, a little over 4 years ago, we had a little over $1 million in reserve, and we had an operating budget of $325,000, which was problematic in a way, right?
Mm-hmm. Yes.
And so what we did is we were really thoughtful as an organization, and we developed a capacity expansion proposal that said, this is the deficit spending that we're going to do over the next couple of years in order to hire the staff that we know we're going to need when we're serving 100%, hire the fundraising staff that we need to support the organization in the future. And it turned out we didn't really do as much deficit spending as I had anticipated. But we also used a big chunk of that, about $500,000, as a down payment on our building, which is what has allowed us to expand that staff and build this Strengthening Families program. So right now we have we went from $1 million to about $500,000, which is 6 months reserve operating for our current budget, which is a little over $1 million. All of the excess reserves that show up in our statement of financial activity and all of that, those are actually restricted to paying off our mortgage because we assumed about an $850,000 debt. So our goal is that after the dust settles and we pay off our mortgage, which we hope to do in the next couple of years, that we will maintain about 3 or 4 months of operating reserve, in addition to an ongoing maintenance fund. Both of those together not in excess of $500,000. And all things, I think COVID taught us a really good lesson that who knows what's around the corner, and we want to be able to really thoughtfully adjust to any sort of future catastrophic event. And we feel like having 3 or 4 months operating is about right. And then if our roof blows off, we have money to repair it.
Right. All right, great. And Caitlin, that was the buzzer. So I don't know if there's a final question or if we want to conclude.
I think it looks like we don't have any more questions. So thank you so much, Jacob and Bill, for being here today. We appreciate your time.
Bill, anything you want to say? Like hello?
That's okay. I'm still relatively new, so I'm here to learn the process for the future. So
okay. Next year.
Exactly.
Okay.
And I'd like to say thank you to all of you who give up your Saturdays to make these difficult decisions. I know there are a lot of organizations out there in need, and we appreciate your time getting to know what we're doing and your continued partnership, because we really can't do this work without everybody pitching in. So thank you so much.
All right. Have a good weekend.
Nice to see you.
Thank you all.
Bye-bye.
Okay, folks, so we're done. Yay! And so as we mentioned at the beginning of the session, our scores are due to get them in the system by the 5th of November. So that's roughly 2 weeks. If you need any kind of assistance, Eliberto is your guy. And then we are scheduled to start deliberations on November 10th. Since the 11th, that Thursday is Veterans Day holiday, so we are meeting on the 10th, and we'll see how far we go. So Brian, do you have a comment?
I do. I just am appreciating Graham's Lily Tomlin impression. If anybody remembers Lily Tomlin and the big chair.
Oh, I was trying to think which. She did a lot, whether she was Ernestine or what.
Yeah.
Edith Ann.
Wow, good memory.
Yeah.
Thank you.
Okay, and so this is Polly's last time with us. So I just want to thank you. And if anyone else wants to jump in, just I appreciate that you have attended and participated, in these hearings, and really has taken your role as a liaison to our Housing and Human Services Advisory Board, very seriously, and you are committed to it. And we just wish you the best that there is beyond this part of your public life. And so it's been great, and we wish you all really all the best for the next path that you're going to go down.
And Karen, no, I'm sorry. Go ahead.
Oh, I just want to say it's been my pleasure for the last 8 years. This is, I think, the hardest working board I've ever been on. And you guys are just incredibly dedicated. And that's how we get everything funded and get people the help they need. And I really appreciate getting to know a little bit about all of you. You are all just wonderful. Thank you.
And I wanted to just say thank you, Polly. I specifically credit you for everything we accomplished with this past Juneteenth celebration. It was your recommendation years ago that we pursue creating a celebration, and our timing could not have ended up being any better having the grandmother of Juneteenth as our special guest before anybody really even knew who she was. And 2 days later, it's signed into law by President Biden. And so you're the person that planned that and motivated me and kind of made me stick with it. And I will never, I will forever remember that, and I'm grateful to you for doing that. And I mean, you set off a path that, you know, it's going to be hard to top what we did here, but we're going to try. But thank you. It's been a joy working with you.
And good luck to you, Shakita.
Thank you.
Yeah.
Thank you.
Yeah.
Yeah.
All right. Anybody want to continue on? Are you ready to go? Have a good rest of your weekend.
Thank you. Thanks to staff too, Karen, for guiding us.
All right. Yeah.
Thank you so much.
Yeah.
All right.
Thank you so much.
Bye, everyone.
Bye.
Bye.
Bye.